Hello and welcome. Carrie here from Healing Humanity, the power of a proper human diet. Welcome to our live stream. Today we're going to explore the crucial link between nutrition and mental health. I'm Carrie along here with my co-host Adam and joined by our experts, Dr. Georgia Eid. We've got Dr. Tony Hampton, who's just fixing something on his computer, and hopefully Dr. Anthony Chafee will be joining us as well. Our goal tonight is to help provide hope for the hopeless while highlighting Dr. Eid's powerful book, Change Your Diet, Change Your Mind. I just got my copy today. I was so excited it came in the mail. I already read the book before. Dr. Eid provided me a copy of it before. I love the book. I absolutely love the book. As someone that suffered from depression and mental health issues, I always show people this. These are all my medications. Most of them were for depression and anxiety for years and years and years. Those really never helped me. And if I had something like this has the answers that I was searching for most of my adult life. So I'm fired up about the book. I'm excited about the book. There's so many people out there who are hopeless. Let's see. I think we got, there he is. Hey, Dr. Tony, how's it going?
Hey guys, how's it going?
Good.
Wonderful. Hi. Welcome.
Good to see you guys and happy to be here, man. This is spreading the message is what we do.
Absolutely. Yeah. So I was just going through what to expect. So in our first hour, we have expert insights from Dr. Georgia Eid, Dr. Tony Hampton, and Dr. Anthony Chafee. He's joining us as long as he didn't get pulled into surgery this morning. So I'm hoping he'll be jumping on here. That's in the first hour. In the second hour, we have several personal stories from individuals. I think we have 6 or 7 of them who have changed their diet, changed their mind, and are seeing remarkable results after changing their dietary changes. So that's in hour 2. And then hour 3 is audience Q&A. So everyone that's on right now, if you have a question, please post it in the sidebar with a QQQ. And additionally, if you have a testimony, if you changed your diet and it changed your mind, share that testimony, and we love hearing those as well. So if we could, maybe we'll start out with, I guess first I just wanted to say I'm so thankful, grateful, blessed, Dr. Tony Hampton, Dr. Georgia Eid, Dr. Anthony Chafee, all you experts. I really appreciate it. If we could, maybe, Dr. Eid, could we start out, maybe if you could introduce yourself and share a little bit about your background?
Sure. Hi, everybody. It's great to see so many people. And I'm looking at the comments here and seeing people. It's fantastic how much interest there is in this topic. So thank you for helping us spread the hope. And great to see you, Dr. Tony, and to meet you, Adam, and to see you again, Carrie. So my name is Georgia Eid. I'm a psychiatrist. I'm based in Massachusetts in the United States, and been practicing psychiatry for about 25 years. And for the last 15 years or so have been using more and more nutrition principles in my practice. And now for many years now, it's been largely nutrition-based and ketogenic diets, carnivore diets, paleo diets, elimination diets, using those instead of medication or in addition to medication to help people with a wide variety of psychiatric conditions. I'm a general adult psychiatrist, so I treat people with every kind of condition. I'm not a specialist, although I did specialize in college mental health for a long time. So I have special expertise in that. But basically, I'm now consider myself a nutritional and metabolic psychiatrist.
Awesome.
Thank you, Dr. Eid. So next we have Dr. Tony Hampton. I just wanted to say first, thank you, Dr. Hampton, for introducing me to Dr. Eid. We wouldn't be here tonight if it wasn't for that introduction. So really appreciate that. Dr. Hampton, could you please introduce yourself and share a little bit about your background?
Yeah, absolutely. And having had you on the podcast, I had heard so much of your story about mental health. And I said, well, who else, would be nice to have on the team. So I'm really excited that she's helping to spread this message and using this platform as well. I'm actually, I've been practicing, believe it or not, for probably 28 years as a family doc. I've been transitioning from the management model of disease to one where Dr. Eid suggested, where we're kind of metabolic docs. And I did that by learning about obesity when I became board certified. And then when I got a master's in nutrition and functional medicine, that helped to kind of explain in detail why we have to think about the root cause of why people get sick. So my practice has transformed as well. And I'm in a traditional health system, a large health system, Advocate Health. In that system, though, I'm allowed to be my individual type of clinician. So in that model, I integrate the metabolic model with all my patients. So if they come in with strep throat or if they come in with depression, I'm always integrating nutrition and reminding people that if they do that along with the conventional things that we do, they'll probably do better. So it's really just creating a model where, and hopefully our new doctors will learn this, if we understand why people get sick and we focus on that, we'll do better. Because I've made that transition, it's been a transformation in my life, because now I go to work and my colleagues will agree, we actually celebrate every day because people are getting better. People are, in many cases, getting off or reducing medicines and restoring their health. I had a guy just today who was being treated for diabetes. And when I told him he can get off his insulin one day, he just didn't believe me. And then I pulled up a few examples of patients who had done it. And he was like, if they can do it, I can do it. So that's what this is all about, giving people another way to heal, not to eliminate the other things that we've done, but to say, can we add this? Can we make that part of the conversation? So it's been wonderful. And that's why we want to kind of spread this message.
Love it. What I really love too is, Dr. Hampton, we interviewed you for the documentary Healing Humanity. And one of the things you said was, I went from being a drug dealer to now I'm a healer. It was such a powerful statement.
Mm-hmm.
Awesome.
And it's true. It's true. It's and it's not, and our colleagues are not exposed to this approach. They don't necessarily read nutrition studies. They don't necessarily see success stories. Rather, it's anecdotal, or you see it in the journals as well. So when you live in a world where they've never seen the study with type 1 diabetes with Dykman and Dr. Eric Westman, and they've not seen people with type 1 diabetes have A1Cs of 5.6, 5.4. They've not seen that. So, and they don't know that you can achieve that without reducing the carbs. So we really are speaking to them as well. We want them to know that there's another way, and no, a A1C of 7 is not satisfactory. So we have to, it's just not, because you're going to still end up over time with the same complications that the person with an A1C of 10 ended up with. So we want to make sure they hear that loud and clear, so that and then they can become healers. They can start to feel like they've made a difference, as opposed to adding more medicines. They get expert at deprescribing. So it's really a completely different way of practicing.
Wonderful. Thank you both. So I just, before we jump into the discussion, I wanted to quickly, again, shout out Dr. Ead's book. There's a link in the description below. And there's also a link to Dr. Ead's social media, Dr. Tony's YouTube channel, social media as well. And for anyone watching that wants to learn more about this, that we're not going to cover through this discussion, get the book. But beyond that too, I just wanted to say, Dr. Hampton, you introduced me to Dr. Ead, and then Dr. Ead introduced me to the folks over at Metabolic Mind. They have an amazing YouTube channel where, if you want to dig into this more, they explore the connection between metabolism and brain health. They've got videos on all sorts of different topics, covering a lot of stuff we're talking about today. So thank you guys. So one introduction to the next. It's been really amazing. So I appreciate you both, but there's links for everything in the description below.
Yep, we're posting the links in the chat too for everyone. And I just want to say thanks, guys, for being here. And I appreciate your book, Dr. Ead. This is truly going to help change the landscape, not only for individuals, but I believe clinicians as well. I've had 2 of them reach out to me that I've contacted in my local area, said that they would be watching tonight. So if you're watching, how you doing?
Hey, welcome. No, that's fantastic, because just as Dr. Tony Hampton was saying, we really need to reach not just people and give them hope, people with mental health conditions, but clinicians and nutrition professionals alike, so that everybody understands some of the basics, just the basics of how to eat properly.
Absolutely.
Hey, Dr. Anthony Chafee, how's it going?
Hey, good. How are you?
Great. Wonderful. Thank you for joining us. we were just doing introductions, so this is good timing. Could you please, Dr. Chafee, introduce yourself? Tell us a little bit about your background.
Oh, well, yeah, So I'm just a neurosurgical resident. I have a practice in functional medicine, preventative health, and I try to just educate people on proper nutrition, how that affects health and chronic disease, and it's something I've been working on for quite some time. So that's my whole thing.
Awesome. Thank you. Thank you all for joining us. I also have a link to Dr. Chafee's channel in the description below, along with links to the books and everything else. I just wanted to say too, this is kind of, I really appreciate all of you for joining us. And I know your time is limited, so this is kind of crazy with 3 hours. We totally understand, Dr. Chafee, Dr. Hampton, Dr. Eid, if you have to drop off before we do this whole 3 hour thing. So for the first hour, we're going to talk about the book. We're going to talk to Dr. Chafee, Dr. Hampton, Dr. Eid. The second hour, we have individuals coming in. The third hour is the Q&A. So we have a few questions right now. I was hoping to ask Dr. Eid. Actually, I'm sorry. Here we go. This is the first question we had. Your book presents a compelling argument for the diet-mental health connection. Can you share what inspired you to explore this relationship in your work?
Sure. I mean, for the first 10 years of my practice, it never crossed my mind, that nutrition had anything to do with brain health. I just, as a woman who had always struggled with my weight since I was in the second or third grade, I just thought of my food choices as a way to control my weight. And, in medical school, we didn't learn anything about nutrition and the brain. In residency, we didn't talk about food once. So I didn't know. And meanwhile, 10 years of practicing, medications and psychotherapy, the way most psychiatrists practice, and as much as I love my work, most of my patients were not getting better. My practice, like just about everybody other psychiatrist I know of, my practice was filling up with people who weren't getting better. And I didn't know what else to do. I didn't know any other way to help them. So just tried one medicine after another, trial and error, which is how psychiatrists still in 2024 practice. Trial and error, trying to guess which medicine might be helpful. And so anyway, I ran into my own health issues in my early 40s. This was, my gosh, more than 15 years ago now, almost 20 years ago, and started experimenting with my own diet to try to help myself with some physical health issues. And what I arrived at through experimentation was kind of an upside down diet that fixed every issue that I was dealing with. All these physical issues like migraines and chronic fatigue and fibromyalgia and IBS. And not only did it resolve all of those problems, but my mental health improved as well. And I wasn't even trying to improve my mental health. I thought my mental health was pretty good. And I think a lot of people do. I think a lot of people don't have optimal mental health and they don't even realize it. So when my mental health improved too on this kind of strange upside down diet, I thought, this diet seems to be good for the brain. I'm a psychiatrist. I've got a lot of patients who are suffering and I don't know how else to help them. I've tried everything. I need to learn about nutrition. I need to understand why this strange, unorthodox diet would improve my brain health and learn whether or not it could help my patients improve their brain health as well.
All right. So this question's for all three of you, but starting with Dr. Eid, considering the global landscape, how dire would you say the current state of mental health is, and what trends or observations have you noted in your own professional experiences?
Oh yeah, and I was telling when we were talking last time, Carrie, it's grim. It's grim, and more than almost 1 billion people worldwide now have a diagnosable mental health condition of some kind, meaning that the condition is so severe that it interferes with a person's ability to function. And that doesn't even count all of the people that are kind of flying under the radar, meaning their mental health isn't great, but it doesn't, it's not severe enough for them to qualify for an official diagnosis. So this is bad. And, the adults across, say, the United States, for example, 1 in 4 have a diagnosable mental health disorder. And now people between the ages of 18 and 25 are young people. It's 1 in 3. So everybody is touched by this. Everybody is either suffering themselves or is directly connected, closely connected to somebody else who is. So it's really awful. And then in my work in college mental health for about 12 years, I worked in college mental health at Harvard University and then at Smith College here in Massachusetts. And it was just getting worse every year. The students who were coming onto campus each year were coming in worse and worse shape, taking more and more medications before they even arrived on campus as a first-year student, taking 2 or 3 psychiatric medications, having already been hospitalized, sometimes even more than once, and needing a lot of specialized support services to get through college. So it started to feel in college mental health like I was working in a crisis center or an emergency room sometimes, where people were coming in, really needing leaves of absence or needing special support or needing sometimes to withdraw from school. So these are people who should be in the prime of their lives. They're really brittle. And I think you'll find this across college campuses just about anywhere you look.
Dr. Chafee, same question for you in terms of mental health. What trends or observations have you noted in your own professional experiences?
Well, obviously, the statistics that Dr. E laid out are pretty stark. I mean, this is obviously getting worse by the decade. I see more and more people, obviously, just in my own sort of personal experience, suffering with mental health issues. And obviously, because my practice in the preventative side of things is very focused on diet and lifestyle, and I get to deep dives into people's health and change their nutrition and these sorts of things, I see massive improvements in people's mental health. And just as Dr. Eid said, this is something that not everybody really realizes that they suffer with until it's gone. And so I've had a number of patients come to me and said that they feel so much better. They have so much more mental clarity, and they have all these improvements in their life. A lot of people come, for like weight loss, or they're just really not feeling well. But the added benefits and improvements that they get are pretty remarkable, and especially like in the teenage populations, that's just a real growing concern. And this is something that I've had many parents come to me when they've been able to bring their kids in, their teenage kids, and that their mental health is so much better. They're doing so much better at school. They're making friends more easily. They're happier. They're not, sort of a depressed, unhappy teenager, and as much as they were. So it's sort of frightening how much of a problem it is, but it is really, really encouraging to see how much benefit these very simple, maybe not easy to carry out for a lot of people, but simple in their design, that carrying out these simple sort of measures can have such an impact in their mental health.
Thank you. And Dr. Hampton, same question for you. What sort of observations have you noted in your own professional experience?
Yeah, one of the striking things that Dr. Eid shared was she didn't realize that she needed some help with her mental clarity, right? So I think what happens is we have people who come to the office and they're suffering from depression or anxiety and all the other health conditions that are related to mental health. And they think it's normal to feel the way they feel. They think that's their normal. So it's just like, I remember the first day I put glasses on, and I didn't realize I couldn't see until I put my glasses on. Same is true. And I had the same experience that Dr. Eid had in terms of, mental clarity, having more energy. We joked earlier. She said, "Aren't you tired, doctor? It's the end of the day." And I said, "Not really." And I think part of now, if it was my old version of myself before I became low carb keto and now carnivore, I would have been tired at this hour. But because of the change, this is my new normal. So whenever I don't feel good, which is what I felt this morning because I didn't get enough sleep, I can't live that way. I just can't, because I'm so accustomed to feeling good. Now, having said that, I'm optimistic about the future in this sense. If we can create a forum like this where we share this message and we have other clinicians, other health systems recognizing that this is a way out, And we use that as a way to then incorporate diet, lifestyle to how we treat mental health. Things will over time change. The issue now is that, and a lot of health systems are doing this, we have to harvest the information. We need to know where people are. So what I would like to see more of, and we're doing this in our health system, we need to ask the question, how, doctors hate to ask that question at the end of the day on a Friday. Is there how are you doing? Most, you don't want to ask it at 5 on a Friday because you're trying to get to your family, right? But if you ask that question, many people, Dr. Eid said 1 out of 3 people have issues with anxiety. And most of us have had issues with anxiety at some point in our lifetime. So if we ask the question and we have a way to address it that works, right? That'll provide hope for people. And I think that although things are not looking as good as I would like them to, I think there's hope. And the last thing I'll say, I'm really big into health equity. So what that means is I want care to be equitably available to everybody. So I need to, when I see a person who's challenged, a young woman who's working 2 jobs, that night shift, got kids, she's single, how do we support her? Because if we don't think about all of those parts of the equation, we may have the best medicine for her, we may even have the best diet, and we know what that is, but is that enough for her? And the answer is probably not. So that's why we have to think bigger, and we have to treat this like a soup of ingredients that we'll need to help people heal.
Wonderful. Thank you. Adam, I think you're on mute.
Awesome, Dr. Hampton. I love that. So I have a question, Dr. Eid, from a lady that reached out in a local community group that I admin on Facebook. And, the mental health landscape out there doesn't seem like it's that great. So it's so bad that this lady decided to just randomly throw out, I need help. And she's looking for answers in terms of her mental health. And I responded to her, and long story short, she kind of has a question that I would like to address and see if you might be able to shed some light on this, especially in light of your book, since I've read it and you do kind of provide some insight into this. So if someone has done a keto diet to help improve their mental health and it helped a little, but was not effective enough, is it possible to see better results on a carnivore diet?
The short answer is yes. And it's actually one of first of all, I'm sorry to hear that she's not feeling well. And I want to give her some hope here that there's more that she could do. And so to keep trying. And one of the things I do in the book is give people lots of different options so that you can keep progressing forward. And so if you try a ketogenic diet and it doesn't help you very much, or it doesn't help you at all, that a really logical next step that I use in my practice all the time, it's kind of my secret weapon, kind of my clinical secret weapon, is to recommend a carnivore diet, even as a short-term experiment, which often then becomes a longer-term life strategy for people who fall in love with it. But it's a really great strategy for troubleshooting. Because it eliminates a lot of the common culprits all at once. It's even more anti-inflammatory. It's even less, toxic and irritating than, it really brings you to the next level in terms of inflammation, oxidative stress, insulin resistance, carbohydrate intake, issues with fiber, digestibility, natural toxins that exist in plants are virtually eliminated. And so for some people who don't respond to ketogenic diets, carnivore diets, not only do they make sense as the next step, but they often work. They don't always work. I mean, there are some people who don't respond even to no matter what diet I use, but the people who don't respond, in my experience, it's a pretty small number. It's a pretty small percentage. I would say less than 10 or maybe even less than 5% of people that I've worked with don't get some noticeable, meaningful amount of benefit from using these dietary strategies. So, but it's definitely not the only factor. There are other things to look at, and I spell those out in the book too. But if you've used keto and it's only helped you to a certain extent and you need more relief, progressing to a carnivore diet is a really, really useful strategy and very much worth doing.
I love that answer.
Along those same lines, Dr. Chafee, how do you have conversations with folks about things like doing carnivore diet or keto diet when so many people are scared? They've been told the opposite their whole lives. Like, how do you broach that?
Well, it depends on how we sort of lead into that conversation, sort of the health issues that they're having. If someone has a mental health issue, for example, I would point them to Dr. Ead's work or Dr. Palmer's work and say, actually, that there are ways that you can actually help this, and that this is it's a growing body of literature on this, and it can help. And I've seen it help people. I've seen it help myself. I've seen it help my patients. And we talk about some of the mechanisms as to why that would be. And this can help other underlying issues as well. So I generally try to lead in by what sort of issue that they're having. If someone were suffering from cancer, be like, well, hell, look, there's something called ketogenic metabolic therapy, as Professor Thomas Seyfried and Dr. Otto Warburg. There's all this body of information. There's all these studies and things like that. And so I sort of lead into it that way, because there are so many different things that this can help. And when you talk to them about how diet and lifestyle has a massive improvement or a massive role to play in health, people do understand that. I always tell them, I preface it by saying, look, there are medicines that we can use and they can be helpful. 95% of the results are going to be from your diet and lifestyle. And so these other things can sort of fill in the gaps, and they can be definitely a very strong aid. But the major things are your diet and lifestyle and getting that under control. And if you fix that, that will do most of the work. And then we can try to, bridge the gaps with medications and that sort of thing. So it's, just basically whatever issue that they're having, try to go in from that angle.
Dr. Hampton, just a quick question. I know you were a vegetarian for a long time, and do you have any patients that come to you that are like, I can't do meat. I want to do ketogenic vegetarian. And do you have success with that? Do they have success with it?
Yeah. I'm a huge component of meeting people where they are. If a person is, their religion says we're not eating cows, they're Hindu. If a person can't rationalize eating animals, as we think about Dr. Chafee's beautiful cat in the background, they just can't do it. They just can't do it. Or they say they don't tolerate meat. Now, we know that there are reasons why they may not tolerate meat. We can fix that. But for some people, they just don't tolerate it. Or culture. So what I say to the people in front of me, there is a way to do, they have a great book called The Vegetarian Reset, which is kind of a plant-based low-carb book. So I say, here's a resource that'll help you. The Diet Doctor website has a whole vegetarian section. So what I do as a family doctor is I provide resources, and I say to them that I'm going to walk with them in spite of the fact that may not be the best diet for them, because we don't want to live in a world where we don't walk with people. Who are they then to go to if you're not the one, right? You're probably the most competent metabolic doc on the block. So why not you walk with them? So what I tend to do is I don't try to push that envelope. I certainly don't do that even with carnivore. I kind of start with low carb and we go from there. But then what I do is I say, there are some things that are traditionally deficient on a plant-based diet. Some of those things we're going to check for. There are some supplements that traditionally are very helpful for a person on a plant-based diet. Let's make sure you are able to do that. I may then, if they struggle, talk them into eating eggs if they really need to get some protein from a source that's an animal source, and sometimes they'll go for that. Obviously, there are supplements that are protein based as well. So for me, you'll never see me in a conversation with a patient trying to convince them of something that they feel strongly about. I just kind of get a feel for where they are. If they're completely clueless about nutrition, I will push them towards an animal-based diet. if they come in with a strong opinion, I just think that that's what we want in our society. If we don't want to be in New York where we have to eat plants on Mondays and Fridays in our schools. We want to be in a society where people are educated from the plant folk, what they think is best, from the animal-based folk, what they think is best, and then they make decisions that are best for their family. That's a better model, and that's kind of what America is all about. And I really hope that as we move forward and we're having conversations with people who are on the other side of the aisle, that they understand that so that we can find some common ground. And I just think that that's the better approach as opposed to making fun of them every day. We're too mature of a society to do things like that.
Yeah. I was just going to say too, that's a really good point. I definitely don't just jump in. It's like, you should only eat meat and don't eat anything else. I always ask them, it's like, so what is your diet like now? And I always sort of get a feel for that, and sort of, and exactly as Dr. Hampton said, try to meet them where they are. And if they're, a lot of people come from, I think upwards of 60% of the people that follow me on social media and YouTube have been vegans at one point. They're health conscious. They're trying to do the right thing. They went down that path. That did not work. And now they're trying to find something else. But I always ask them that. It's like, well, what are you eating now? What is your diet like? Almost all the time they'll say either good or bad. They'll say, it's like, oh, it's pretty good. Okay, what does that mean to you? And then we sort of go through that as well. And some people, oh, it's really awful. And then you know what they're talking about, processed food and sugary sort of stuff like that. But yeah, that's a very good point, is that you need to sort of find out where they're coming from. Because if you just jump straight into what your opinion is on a diet side of things, you can get people pulling back quite quickly on that. And then you'll have a much more difficult conversation.
Yeah, and there are just I agree with both of you. There are just so many improvements you can make to a diet. I mean, if you're eating a standard diet, just about any change you make is going to be a step in the right direction. And so, like both of you, I mean, I tell people that I'm nutritionally pro-choice. So I just want you to have the right information so that you can make your own informed choice, and you can decide what's most important to you. And if you decide that eating animals isn't something that you feel comfortable doing, I'll still help you obviously optimize your diet to be the brain healthiest that it can be, because there's still lots of improvements you can make to your diet, even if you don't feel comfortable eating animal foods. And especially, and I make this point in the book because I think this is, from a psychiatrist's point of view or a psychological point of view, really important, is that red meat in particular, I think, is really difficult for a lot of people to feel comfortable eating, because we're talking about mammals, our fellow mammals. We can make eye contact with them. We have a lot in common with them. It doesn't have to be red meat. You can get the nutrients elsewhere. So for a lot of people, they make that equation, I'd have to eat red meat to be healthy. And there are definitely other options. So, like both of you were saying, meet people where they're at, find out where the improvements can be made. Be flexible and open-minded, and find out what their goals are, meet them where they are. And, because, most of my patients, especially when I was in college settings, they weren't choosing vegan or vegetarian diets for health reasons. They were choosing them for compassionate reasons. And so they just thought that better health was icing on the cake. They didn't realize that there were actually health risks involved in not eating animal foods. And that's where the information gap is. So, I think, being a good clinician is about meeting people where they are at, regardless of what I may think about what they should eat or what they should prioritize.
All right. Here's a question for the group, starting with Dr. Eid. The standard American diet, obesity, and mental health issues are accepted as new normals. Social norms are hard to break. How do we break these social patterns?
Oh, what an interesting question. Right. It's become normal to expect poor mental health. Poor mental health has become normal. Obesity has become normal. When I was a kid, when I was growing up, I was overweight as a kid, but I was one of the only overweight kids in my school. I was really, really unusual. I really stood out for being overweight. And now you look around and most kids are overweight. And it's unusual to see kids that are of healthy weight and looking physically fit and well. So that is a problem, because especially my work with college students, my most recent work with college students between 2013 and 2018 was at Smith College in Western Massachusetts, a women's college where there was, one of the ideals on campus, or one of the philosophies on campus, was body positivity, right? Health at any size, body positivity. And so I don't talk with people about their weight generally. I talk to them about their mental health. That's the focus of my work. But it's often, it's very common for people to confuse these two things. And so really being overweight is just a symptom. It's just a symptom of underlying poor metabolic health. It's not the thing that I care about, or that I think that even that you should care about, whether you do or not. It's up to you. But my goal is better metabolic health, because if you can improve your metabolic health, your weight will improve if that matters to you, and your mental health will also improve. So how do we break these social patterns? I think one way is to separate out in the conversation weight and health, because I want people to focus not on their weight. I want them to focus on the things that actually matter, that they can change very quickly. It might take you a year to lose weight to get to where you're trying to be. It can take you a matter of days or weeks to normalize your glucose and insulin levels and have all of your cells start to work better, function better, including your brain cells. And once that happens, then you're setting a new standard for what it's like to be a healthy human being. And it's catchy. People see that you're feeling better and sounding better and looking better and performing better, and they want to know how that happened. And that, regardless of how much you weigh at the time that you're making that change. So if we could shift the focus of the conversation off of weight and onto metabolic health, and then everything else should improve by leaps and bounds as a result of that.
Thank you. Dr. Chafee, do you have any other ideas for breaking social norms? Like sugar's the big one. It's just like, oh, it's not that bad. It's just sugar. We've always had it. We give it to kids. It's in cartoon characters on cereal boxes. You go to grandma's house, she gives you cookies.
Well, I think that's obviously a very big one. I mean, I've sort of equated this to the opium trade. Historically, this is some massive enterprise that's harming a lot of people, but it's making just fortunes for a lot of people. So it's not something that they want to give up, but this is a drug. We need to understand it's a drug. It affects us mentally and physically in very negative ways, and we're putting this in everything. The sugar companies, I believe, know for a fact that this stuff is addictive and this stuff is causing harm. People like Callie Means, who's a sort of whistleblower for the food and drug companies, says that they know that this causes metabolic ill health, that this causes damage, and it's addictive. And he says, I know that they know this because I've been in the boardrooms with them as they spoke about it. So this is something that I think we need to have people recognize that this is a drug. This is something that we really shouldn't be giving to our children, and probably shouldn't be using ourselves, but at least should not be putting this in baby formula and giving candies and chocolates and sweets and everything. But they like them. Well, they'd probably like cocaine too. That doesn't mean that you give it to them, right? It's not very good for their body and their developing brain. So I think just having people understand just how bad these things are is really important. No one should be made to feel bad on their appearance or the way they look or their health, certainly. But there is this growing movement of saying, hey, look, this is good to be overweight. This is healthy, all these sorts of things. And there are these influencers that are overweight and have entire channels where they're just gorging themselves and eating these junk foods. And many of them have died in the past year. I mean, this is a very bad example to set for people. This is a very bad thing to be pushing, driving people to doing themselves. These influencers, they're being paid to make these videos by the processed food companies in order to normalize eating garbage. And so we need to normalize eating real food again. We need to make that normal. We need to make it normal and acceptable to actually care about your health and understand that there are things in the world that actually do damage our health. And it's okay if you're unhealthy. And it's okay if you make these choices. You're not a bad person. No one's mad at you. But it actually is unhealthy, and that it is okay to be healthy. It is okay to try to worry about your health as well. Some people get stigmatized for being healthy. I mean, I've seen people. My girlfriend Elle, she would post something, and most things comments are positive, and then some people are like, "Oh, I can't believe it. I think that's disgusting. How skinny you are." This and that. What kind of comment is that? And especially because of someone who was underweight and is now actually eating more and is a more healthy weight, and they're telling her how disgusting she is, that she's so skinny. I mean, it's just like, this is not healthy, and that's not a healthy dynamic. That's not a healthy sign of a healthy society. And so I think we need to normalize being healthy again, and that's okay to actually worry about your health and avoid things that are harmful, like sugar.
Thank you. Dr. Hampton, do you have any thoughts on breaking these social norms?
Yeah, I think most of us, when you think about the average person that we know, they really don't want to be on a diet that's not good for them or their family. Nobody really wants to be at a weight that's not considered healthy. Nobody wants to suffer from mental illness. So I think when I think about this, I think about even how I perceive the world. And I remember before I got training in functional medicine, I thought that I was being a pretty good doctor by looking at a patient and diagnosing their disease. If I diagnosed their disease and gave them the right pill, procedure, or surgery, my perception is that I'm a phenomenal doctor. And then I learned that there's another way of doing this where I can ask a different question, which is, why did the person get the disease in the first place? I never really was trained to ask that question. I thought that diagnosing the disease or figuring out which organ was sick and fixing that organ was the right way to do things. So when you think about the current conventional model of medicine, where we look at symptoms, we diagnose organs, and we even do a good job of detecting it early. But that model is not the model I follow now, where I think about how not only to prevent disease, but if you get something, how can we reverse it? And if we heal people and reverse disease, that's a better model. It's a more holistic. It honors the individual patient, because there are times when, even when you're in the hospital, and Dr. Chafee really knows this, if you have a certain diagnosis, you have a certain amount of time you're supposed to be in the hospital. Think about how ridiculous that is. So, but every individual is different, every human system. So if we treat the entire human organism, and we then put that in front of our clinicians and say, guess what, guys? What we were doing previously is probably not the best model. And I think for patients, if they see that there's another model, literally just today, I had a conversation with a patient about their kidneys. And they were told by the kidney doctor, we can't improve that. And I told him, you can improve that. I shared a study with Dr. David Unwin in the UK, and how he, over the course of 7 years, did a trial where renal function got better on a low-carb diet. It just is what it is. So I said to the patient, you have a fork in the road moment. You can go this way or that way. And I'm saying my way is that there's hope, and the other doctor's way is we're waiting to determine when you go on dialysis. Mm-hmm. So if people are given a convincing argument and we use logic, they'll be very, very eager to hear what you're selling. They'll be very eager to provide hope to that family member who is making these life-altering decisions and being told there's nothing we can do. So again, there's a point when you have to use those options like dialysis, but in many cases, if you get it in early, like with dementia, Dr. E would say, If you get it early, there are some things that we can do. And if we don't do that, we're shame on us. And my hope is that this is why her book is so important. If there's somebody in your life who is on the verge of dementia, they have cognitive decline. If there's somebody in your life who's had bipolar and their life is a wreck because they can't function in society. If Kanye West was given this option instead of pills, assuming he has the diagnosis, I had to go there. Imagine how creative he could continue to be if he was able to maintain his creativity with a diet as opposed to taking a pill that takes it away. So it's just a better option. And all we're saying is the word option. We want it to be an option. And if people are given that option, it'll change the whole landscape. But doctors are not aware of anything we're talking about. So that's the problem.
Right.
I was just gonna add to that. How you were saying about there's certain disease and you have certain days in hospital. It's even more than that here in Australia in the public hospital system. You only get paid by those certain days. Someone comes in with an appendicitis. Appendicitis takes 2 days to treat. I don't know if you knew that. And so if you come in with appendicitis, you will be paid for a 2-day hospital stay. And if they're in for 1 day or they're in for 5 days, you're getting paid for 2 days. And so it's up to you to make it fit that mold to get those round pegs in those square holes. And then they sort of do this retrospective look and they look at the averages for that year and say, okay, well, these are the new averages. This year you get 3 days for an appendicitis and all that sort of stuff. So it's quite funny how that actually is literally the case and for the funding year. And you're talking about we're talking about stigmas and things like that. Well, one thing that I think is really important that Dr. Hampton brought up is that people do have the right motivations. They do want to try to be healthy. They're just maybe given the wrong information, and some of that is saying that there was that statement that came out in the last couple of years saying that genetic or obesity is basically genetic. If your parents were obese, 80% chance that you're going to be obese, nothing you can do about it. And that's quite defeating for some people. And it just tells them there's nothing you can do about it. It's out of your control, and just give up, basically. Take Ozempic, and that's the only thing that's your only option. And of course that's not the case. Of course that's of course you have something that you can do. Of course it's within your control. You just need the right information. So I think a lot of people are really hungry for that information and the right information. They're just being led in very different ways, which is why these sorts of conversations are so important, which is why everyone here's channel and the work that they're doing is really important to sort of get that out there so that they have hope, they have options, and they can do with those options what they please, but at least they understand that there are options. And there are a lot of people, like if you leave the vegan group, you get ostracized, you get attacked. Generally, when someone leaves carnivore, they say, "Oh, well, I just couldn't do it. I really liked it." I was like, "That's fine. At least you know that how it worked for you. At least you have that frame of reference. And if you feel that that's something that can help you in the future, you can always come back to it. At least now, And a lot of people say, well, I felt really good. I felt a lot better. All these things improved, but just for family reasons or this or that. Fine. That's fine. It is your choice, but at least now. At least you have this tool in your repertoire that you can use at a later date if you want to. And quite often they do. They're like, oh, I kind of want to do this. So I was like, well, how to, I sort of want to lose weight. I had a friend of mine doing that at a competition in our hospital, who could lose the most weight in a certain period of time. And one of my friends had done carnivore and he'd lost 20 pounds in a month. And I said, well, the trick, how to do it. And he sort of went, yeah, actually, yeah, no, you're right. Yeah. I can just eat carnivore and I'll just win this competition, so at least they have that frame of reference and they have those options. And I think that's really important.
I mean, people don't realize how much more control they have over their health, their physical health, their mental health. We're told, picking up on what both of you were saying, we're told that all the risk factors for a lot of these diseases are things we have no control over, when it's not true. So we're told that, for example, with Alzheimer's disease, that the risk factors are how old you are, what your genes are, what your family history is, and you don't have any control over any of those things. So you just kind of sit around and wait, think, oh, am I going to be next? Am I going to be the next person to get Alzheimer's? There's nothing I can really do about it. So I guess I'll just got to wait and see, like a sitting duck. But most people still don't know, even 20 years after it's been confirmed, that insulin resistance, like insulin levels running too high too often because of eating the wrong way too often, that's a tremendously powerful driving force, a causal force behind most cases of Alzheimer's disease. And most people still don't know this. And you have tremendous control, almost total control over your insulin levels. This is something you can do a lot about really quickly. So these are the pieces of information that, for whatever reason, don't break into mainstream medicine. And still people are just waiting and looking for these super expensive drugs and injections that have terrible side effects and that barely make a difference. It's just so hard to understand sometimes why that kind of information penetrates the mainstream thinking in medicine, and information that's really powerful and empowering doesn't seem to cut through the noise. But I think most people would want to know that there's something they could do about Alzheimer's. It doesn't mean they all would, because it's hard to change your diet. It doesn't mean they all would, but I think people deserve to know, so they, like you both were saying, so they have the option to make a different choice if that's what they care about.
I think that's a really good point with Alzheimer's. If this is completely out of people's control, it just comes down to genetics and family history. Then why was it only discovered in 1906? Right? Right? Why is there nothing in the medical literature going back to Galen and Hippocrates that described a similar pathology? It showed up in 1906, and Dr. Alzheimer's presented this at a conference, and people were just kind of like uninterested. They're like, "Yeah, whatever." It's just this is a one-off, and but it obviously grew since then, unfortunately. And so, if this was completely out of control, had no environmental, inputs, then we would have seen this forever. One of my professors in medical school said, Alzheimer's is inevitable. If you live long enough, you will get Alzheimer's. Okay, then why are younger and younger and younger and younger people getting Alzheimer's? Explain that. Why are people in their 20s? Why is there juvenile Alzheimer's now? Why the hell is that a thing? And so if this is just a matter of age, then why is it spreading to more and more younger people? That doesn't make sense. If just as you get old, you get senile. Well, okay. Well, then why did they have to kill Socrates for causing such a ruckus at 76? And these are people lived to be great ages as long as they weren't killed by something. And that's what people don't understand. There's a difference between average life expectancy from birth and how long you lived if you weren't killed by something. And so there were plenty of people that lived to be a great age. We did not see these diseases. We saw it in 1906 and then 1896. Life expectancies were very similar at that point. You look at the census data in America, it goes back to 1850. It goes decade by decade. If you were born in 1850, your average life expectancy would be 36, 38. But if you made it to 10 years old, you'd make it to 56. If you made it to 20 years old, you'd be in your late 60s, and so on. And so if you made it to adulthood, the chances were you would live a great age, and very similar ages to what we see now. And yet no Alzheimer's, and yet Alzheimer's is growing now in younger and younger populations. So of course there's something that we can do, and if we can affect it from a preventative standpoint, we should be able to affect it from a treatment standpoint as well.
And I'll add this. It's kind of interesting how many of us, when we made our lifestyle changes, ended up at carnivore, how we talked about the things that got better, not suggesting we had early Alzheimer's, but guess what? Our memory got better. That sounds familiar. Our ability to concentrate got better. That sounds familiar. Our mood, we were easier. My wife's like, it's easy to be around you, sir. And that's because, and guess what? When you have somebody with dementia, their mood changes. They can't remember things. So what I'm saying is there are so many signs of poor metabolic health in society today. And it's not necessarily happening when you're 80. It's happening when you're 20. When I was not metabolically healthy, I would literally be at the lights because I was so like tired, I'd be sleeping at the lights. I would be talking to patients and they would say, "Doc, are you with me?" I'd be dozing. I wouldn't, and I'm making decisions, life and death decisions about their health, right? So imagine you have a family member who is showing some of these signs right now. And imagine you know what you now know, that a keto or carnivore diet can actually start to heal that poor metabolic health. Imagine what things will look like 10 years from now if you don't provide that information. Imagine what life-changing information you can provide. So I just think for all of us, things like dementia has so much potential for change. If you go into the average nursing home today, where they have a dementia floor, you will find they're getting dessert after every meal. Most of the stuff on their plate is starchy. And you'll see them in an environment where it'll only worsen their dementia. Imagine now we have a metabolic dementia place where we actually feed them a keto or carnivore diet. We keep them active, we keep them stimulated, and they may get so good that they have to take them off that floor and put them on a regular floor. And we've seen people improve to the point where they don't need the type of help they once had. So again, these are the little talking points that I'm sure Dr. Georgia Ede shared in her book, but more importantly, that you need to know so you can provide hope for your family.
And Hal Kramer's work is really remarkable in this regard, in terms of, putting people with dementia on healthy diets and then seeing them improve and not need assisted living facilities anymore. I mean, this is aging in reverse. This is bringing healing. And this is what a lot of people have been told isn't possible. We've just been told that there isn't anything you can do, and here's your diagnosis, and get your affairs in order. And we're now seeing, I've seen this in my own practice. There are some published case reports, and I put examples in the book as well of people reversing symptoms of Alzheimer's disease using dietary strategies. And I mean, if more people knew about this, I do think that they would be excited to try some of these strategies. But as you're saying, we think of, especially as people get older, they think, well, I'm 80, I'm 85, I'm 90, I'm just going to eat whatever I want. Because they're thinking, it's all about their waistline. But it's not. It's about their brain health, but they don't know. So they don't know that the choices they're making aren't just about vanity. They're about sanity. They're about your mental health, your ability to connect with your loved ones, to remember their faces, to have joyful times with people. And you can get a lot of that back if you start early. Alzheimer's, just like type 2 diabetes, takes many, many years to develop. It's not as though suddenly overnight when you wake up at 75 years old and you have early dementia. It's been quietly brewing in the background for 20, 30 years as you become more and more insulin resistant and your brain becomes less and less energized, and it starts to gradually begin to die. So obviously earlier the better, but we've seen cases where people are even already have early Alzheimer's. And I put, as I said, an example of this in my book, but there are published cases as well where people actually improve even after they've gotten the official diagnosis, and in some cases improve to better than they were before they got the diagnosis. And so I think it's really extremely hopeful and empowering for people who, like we're all saying, who want a different way, who want to do something about it, rather than just take it lying down.
I just want to add to that. I love how you said a different way, because I think that's one of the big things is there's a billion people, like you said, suffering from mental health, but there's a couple people doing it a different way. This whole positive deviant thing, they're doing something drastically different and they're having amazing results. We need to really elevate the voices of those people. Every one of us here on the call are positive deviants doing something drastically different, but we're all having amazing results. I really think that's one way to break those social norms, is to elevate the voices of people. They're trying something different, but having just incredible results. The only other thing I wanted to say real quick too is one of the things I've learned doing this documentary that's just been incredible, I started doing it for mental health, fix my depression, anxiety. And I started talking, like Dr. E talks about metabolic health. Well, then I talked to Dr. Philip Ovadia about heart health, and he's talking about metabolic health. Then I had Professor Seifried on the channel, and he's talking about metabolic health. Starting to see some patterns here. It's like every single person. So for people watching this, it's kind of amazing. It's all connected. It's like, you want to do this to fix your mental health. It's amazing. It's the only thing that did it for me after going on all of these pills for most of my adult life. But all these other things are fixed too. And like we were talking about, I'm pretty confident my odds of getting Alzheimer's or dementia or cancer down the road is greatly reduced because of it. So awesome. Adam, did you have a question?
Before we move into the next segment, I want to give a quick shout out to Dr. Ead's brand new book, Change Your Diet, Change Your Mind. Absolutely phenomenal book. And it also doubles as a breastplate armor, a bulletproof vest, because there's no possible way that you're going to blow any holes in this book with over 100 pages of references. It's absolutely incredible, and the content is unreal. I do have one quick question for you, Dr. Ead. So in your book, you talk about quiet paleo, quiet keto, and quiet carnivore diets. You know, that's kind of something that you established in your book. And how is that different for someone with a mental health issue compared to what we know as the standard diets of those?
Sure. So I put these 3 different strategies in the book. First of all, so people would have a choice of where they wanted to begin and where they wanted to go. And because I ketogenic diets are really the cornerstone of my practice, and because I work in brain health, and so ketones to energize the brain can be really a game changer. But not everybody needs to do a ketogenic diet to see results, and not everybody wants to do a ketogenic diet, and not everybody can do a ketogenic diet. So I want people to know there's so many other ways that they can improve their brain health. So I have as you said, quiet paleo, quiet keto, quiet carnivore. And the reason I say quiet, so the reason that these are different, the way that these are different from standard paleo, keto, and carnivore diets is that I've modified them in these kind of special ways to be quieter on your gut, on your mitochondria, on your nervous system, on your immune system, on your thyroid health. Just easier to digest, lower in plant toxins. I've taken some of the most aggressive types of plants out of the diet, and also it's lower in histamine, so it's lower in processed meats as well, and doesn't include any dairy. And so these are quieter diets. And the reason why I do this is because I want people, I'm asking people to change their diets for something like 6 to 12 weeks, depending on which part of the roadmap you follow. If you don't see results pretty quickly, you might give up. You might get frustrated and give up. So you can definitely still follow a standard paleo, standard keto, or standard carnivore diet. Absolutely, please do. If you don't have to follow these quieter versions, but for people who either don't respond to those standard versions of these diets, or who want the most possible relief in the most efficient way in the least amount of time, with the least amount of troubleshooting necessary later on, then that's why I designed these diets, because you can find paleo, keto, carnivore diets elsewhere. So these are based on all the troubleshooting of people's diets that I've done over the years. They'll come to me and say, "Oh, I've tried keto, it didn't work. Or I tried carnivore, it didn't work. I tried paleo, it didn't work." And so I've learned, how to modify these diets for better results. So essentially, taking out the most common culprits, so that people have a more efficient experience with experimenting with these diets.
Awesome. I love that. I definitely appreciate your version of it, because I have a histamine intolerance. So, yeah, that could be a big issue for some people. And I didn't know it for the longest time. I felt so good on carnivore, but, the histamine was causing an issue, and it was good to see confirmation of that in your book. So I definitely suggest everyone get a copy of the book, read it, and learn something new, and start yourself down the road to healing your mind for sure. So with that, Carrie, I think we have some guests that we're going to bring on here.
Yes.
Absolutely. I think our first guest, let's see. There we go. Larry, how's it going?
Larry.
Carnivore Soldier.
All right. Can you hear me?
Yes, thank you. So we're hoping, Larry, to hear your story, how you changed your diet and it changed your mind, and then open it up for if you have questions for Dr. E, Dr. Chafee, or Dr. Hampton. So yeah, looking forward to hearing your story. Go ahead.
Yeah. So I'm a retired soldier, chief warrant officer, retired signal soldier. And I basically in last year in March, I was at 280 pounds. I'd retired from the Army in 2019 at the age of 53. So I had a long run. And all my life, I've been an athlete and a military person. So I've been able to maintain my fitness pretty well. In fact, when I get ready for schools in the Army, I would do a keto to get ready for a school to transition to optimize my health. I knew it worked. So I remember I went to warrant officer candidate school. I was selected late in my career. I was 45. I was the oldest guy in the class. And in my class, the average age was 23. They were mostly pilots. And I was a signal chief. So when I got there, they were running 7-minute miles. And the best I could do at 45 was 8. So it was really a challenge. But so I knew keto worked. But again, all I did was experience the weight loss and the up energy is all I got out of that. I never got like the full transition package until I was just looking at Jeep parts because I'm a Jeeper, and I was up to 280 after I'd gotten out of the Army. I'm 6'3". I got to 280 pounds. I ballooned during COVID, and I was just out of control and really depressed. And I saw a video with Dante Ferrigno, which same one you saw, Carrie, and about the same time, about 3 days after you started, Carrie. I'm on the same track as you. I think I'm on day 307 or 308 or something like that. So once I saw that video, I thought, well, I'm going to call BS on that. That's not real. So then I knew it was an old video, so I looked at a current video, and they're like, wow, the guy looks better. And not only did he look better, he was animated differently. He spoke differently. Everything about him was a different person. And I was like, man, I want that energy. I want that. But I still had a hard time believing it. So then I saw I Googled it, of course, and I saw Dr. Ken Berry doing it. And I knew him from keto days before he was carnivore. So I used to follow him when I'd get ready for schools. So I'm like, well, this guy's legit. And if he's actually going carnivore, this has got to be real. And then I found Dr. Chafee, and I found Dr. Hampton and all the other doctors like posting stuff, Kiltz and Baker. And I was like, okay, this is real. So then I just made the decision, like most military people will, to cross the Rubicon. I was gonna burn my ships Cortez style, and either this was gonna work or it wasn't. But it wasn't gonna be because I didn't put in the effort. So I did maximum effort. I cleaned out in one day, cleaned out my cabinet, just went and bought a bunch of beef, eggs, and I just said, that's it. It's gonna happen, and it did. And then I could tell you in the first month, 26 pounds lost. My brain fog lifted. The anxiety that I didn't know I was carrying was gone. There was anxiety I didn't even realize was there. Gone. Depression, gone. So everything changed. And then I continued to lose weight. I'm down to 232 pounds now, almost my playing weight. When I get back to 228, that's my rugby weight. All right. So that's what I'm going for. Trying to get my 6-pack abs back. I'm running sprints. Thank you, Dr. O'Mara. I'm doing all this great stuff now. But my first 6 months, I did no exercise and went from 280 to 234. And I mean, ridiculous weight loss, and put muscle on and not exercising. So I realized that there's something to this that was just too amazing to not share. So I started sharing with people around me, and then people started changing their lives, and they started sharing it, and it started making a ripple effect where people I didn't even know were getting into this. And I thought, well, I need to do a YouTube channel, I think. And so I just started a YouTube channel, and that was in August 7th. And I realized that, being a first responder, I worked in law enforcement for a while, 5 years, and I did 20 years in the military. So I realized that the military and first responders are the warrior class of the West, right? We are. And we don't like to show weakness. We don't like to share problems. We like to fix stuff ourselves. And, you look to the guy and the gal to the left and the right, and they're doing it. So you're going to do it. You're just going to suck it up and drive on. And that's what we're taught to do. And that's what we do. But that combination with the standard American diet I think is causing to our higher suicide rates. I mean, I have a theory. I think it has to do with, serum cholesterol levels and people's taking impulsive actions and violent actions. They've done a lot of studies on that. And I'd love to hear your guys' thoughts on that. But I know the brain's not working properly. And what's happening is people are taking permanent solutions to temporary problems. And I think, they're committing suicide. And, to be honest, I've got PTSD. I was depressed. I've been there. I've been on the edge, and I've lost more people that I know personally in the military to suicide than to combat. Far more. It's terrible. So I decided to start this channel and dedicate it just to, it's for anyone, but it's really geared towards first responders and veterans and active duty. And so that's why I try to interview and gear stuff, conversations towards that community. How can we get those people convinced to try something like this? Because most of them don't want to be on drugs. They don't want to go to counseling. They don't want to go to a doctor. They want to fix it themselves. And if we can give them that tool and show them that it really works. So that's my story. That's why I'm here.
That's awesome, Larry. So we have another guest coming on here in a minute, but do you have a real quick question for the panel before you have to go?
Yeah, I would just ask you if what would you recommend for first responders and veterans, like how to get started on this, especially knowing that a lot of them, by the time they're pretty desperate, they're on a lot of medications, antipsychotics, depression, whatever. They're on. How do you transition to a carnivore diet when you're taking this, VA cocktail?
Yeah, so I was just going to, if I might jump in, because I was going to ask you the very same question is, were you taking medications at the time when you decided to change your diet? Because that can be problematic, navigating the transition between a regular diet and a ketogenic or a carnivore diet. The medications can cause problems and they need to be really closely monitored and adjusted. So if you've got people who are on psychiatric medications who need guidance around that transition phase, then I have a free clinician directory. Specific, it's international database. You can search it. We're trying to continue to grow it. It's got maybe about 200 people on it now, but clinicians who use ketogenic diets specifically to treat mental health conditions. So you can look for prescribers on that list who might be in your area to help people with these transitions, because that really is the most complicated piece of it. It's a very, very healthy diet. It's just in combination with medications and certain health conditions, it can be tricky. That transition period can be tricky.
That's great. And where can we find that? Do you have a website that has been shared that we can look at that for? Or?
Oh, yes, I'm sorry. So it's on the website's diagnosisdiet.com, which is the name of my website. And there's a tab called Directory, Clinician Directory. Just click on that and you can search it for free.
All right. I will definitely share it with my veteran groups because that has been asked many times. And I know it's a serious deal.
It is. Thanks for asking that.
Yeah.
Thank you so much, Larry. Shout out Carnivore Soldier. We have a link in the description below. Larry's doing some great work for vets, and love your channel, Larry. Thank you so much. Have a good day.
Thank you.
Larry.
Right. I was just gonna say one thing as well, Larry. You mentioned about the serum cholesterol and so forth. I actually have come across studies, and maybe Dr. Eid can shed more light on this if she knows. But I have actually found studies that show that people with depression with lower LDL cholesterol had higher suicidality.
Right.
And so there seems to be some sort of connection there. As a very aside, you were talking about how you, without lifting weights, you were putting on muscle and losing fat. There are a lot of people that say that you have to you're either bulking or cutting, you're either putting on fat and muscle, or you're losing muscle and fat. You cannot put on muscle and lose fat. And if that's the case, then why is it that I lost 23 pounds in 10 days, stopping vegetables and eating more meat, and then didn't lose a single ounce or change my weight an ounce for 6 months, and yet went from being overweight to 6% body fat. How did that work? Exactly.
Yeah.
You know? And so, I mean, it's just, there's some silly things out there that people just repeat ad nauseum, and then they just are taken as truth after that. So I just wanted to
Thanks, Doc. And hey, if you guys are going to be at KetoCon, look me up. I'll be there.
Yeah, I'll be there.
All right. See you there.
Awesome.
Thanks, Larry.
Yeah.
Bye.
Larry.
Awesome. All right. Next up, we have Emily Penton. Emily is, speaking of positive deviance, Emily's amazing. She's got a great story. Emily, could you share your story with us, please?
Yeah, I had a debilitating mental illness. I had bipolar disorder that turned into rapid cycling. And I had my master's in clinical counseling. I was working in the mental health field, so that didn't really bode well for my career. And so it became unethical, where I was just like, okay, I don't know who I am from one day to the next. It was like Dr. Jekyll and Mr. Hyde. And so I quit working and I moved in with my mom at the age of 40, which was just devastating to have my master's degree and then like totally like out of work and homeless. And thankfully, my brother reached out to me, told me about carnivore, because at my most, I was on 900 milligrams of lithium, 80 milligrams of Prozac, 80 milligrams of Adderall just to get out of bed every day, and then Ambien to sleep every night. Can you imagine what my organs would have done if I had continued that regimen? I had been on that for about 8 years. And thankfully, my brother told me about the carnivore diet. So February 24th of 2019, I went overnight. I went away from the standard American diet, the cookies, the donuts, the pizza, the soda, the everything. And I only ate animal meat and animal fat. And I was very intentional about the fat. And then my last bipolar episode was April of 2019. I continued to work with my psychiatrist because he had seen crazy Emily. So I knew he was the only one who was going to be able to like see if she comes back. And we stayed and we tapered off of all of my psych meds. September of 2019 was my last psych med, and I have been stable. And now I help people all over the world, to really break out of depression and anxiety and bipolar disorder.
That's fantastic. That's a great, thank you.
Yes. So my question for you guys would be, I have so many clients who come to me and they've tried carnivore, and I ask them what they're eating, and I see that they're eating very lean. And I also, my side effect of everything is I lost 120 pounds. So for some reason, people are eating very lean. And then whenever they're coming to me for anxiety and depression, I always tell them to increase the animal fat. And every single time their depression gets better, their anxiety gets better. Why is the animal fat so effective?
Well, I mean, I don't think we know 100%. I mean, I can throw out some hypotheses, and I'd love, both of everybody else to chime in too. But part of it may have to do with the ratio of protein to fat in terms of supporting the ratio of the molecules that you're taking in that are building molecules and the molecules they're taking in for energy. And if you have that ratio correct, and some people say it needs to be, even 2 to 1 in terms of the grams of protein to the grams of fat to the grams of protein, a lot of people feel their best when they have that higher fat to protein ratio. So I mean, it is more ketogenic that way, but you can get into ketosis eating a low fat diet too, as long as it doesn't have carbohydrate or very little. But there seems to be so there are important nutrients and molecules in the fat that they've been missing out on. There are nutrients in the fat, and so this is something that a lot of people don't think about. Who eat a standard diet, we think of fat as it's just extra calories. All it's going to do is make me gain weight. They don't think about fat as containing vital nutrients, and we cannot live on protein alone. So it's partly getting all the nutrition you need, and partly that ketogenic ratio of fat to protein, especially for mental health, seems to be very important. And some people do need a relatively high ratio. Anybody else want to chime in on that?
Yeah, well, if I can jump in, I would just agree with all of that. And what I point out to people is that, fat is not just a calorie source. It is an essential nutrient. It's a conglomeration of essential nutrients. They're essential fatty acids that you have to have for optimal health, or you may even, die. There are essential fat soluble nutrients that you have to have, or you'll be unwell and you can die. Your brain is made out of fat, right? There's 60-70% of your brain, the physical structure of the brain is fat. And so, DHA, EPA, these are major components of your brain. 20% of your brain is DHA. A large portion of your brain is cholesterol. So, without the fat, cholesterol, and these fat soluble nutrients, you simply cannot even build the physical structures of your brain and build and maintain them, let alone run them. Obviously, being ketosis, I think we would all sort of agree that that's an optimal fuel for our brain as well. And like Dr. Reed said, you can certainly be in ketosis, but sometimes eating more fat can help that. But I think the major one is nutrition. Your brain needs nutrients that are in the fat that we cannot get from anywhere else. I think that's a major part of it.
Yeah, and I'll just add that I think it's true that we've evolved to eat fat, and we've been eating fat going back, years and years, way before we existed. So that's the first obvious answer. I think what I find is that I try to teach my patients that there are, you have your 3 macronutrients: fat, carbs, and protein, and the fat is the most underutilized source of fuel that you could probably imagine. And the analogy I made previously on a video was this ideal of a fuel tanker. And, honestly, what's wrong with that fuel tanker driver? He continues to fill that little tank with what I would call starch and sugar and grains, right? And he keeps going to the gas station when he has all of that fuel sitting there. Why can't he use that fuel? So when I train my patients to eat keto or carnivore, I'm training them to utilize all of this energy, which is way more effective. If you're trying to get energy out of glucose, the number of ATP or energy that you get from it pales in comparison to the amount of ATP you get from like a short chain fatty acid, for example. So the goal is to utilize this phenomenal fuel source so you'll feel better, have more energy, it's more efficient for your mitochondria, it's clean fuel, it's fuel that's like a solar panel versus like a factory with all that smoke. And when you're talking about mental health, you have to get rid of all that crap once you create it from glucose. Why not use fat fuel instead, which is more efficient? You don't have the byproducts, and your brain loves it. Now, there's things that Dr. Georgia Eads suggested we don't know. There's things about being in ketosis we don't fully understand. We just know when you're in ketosis and you're using fat as fuel, your body likes it better. So if we can convince people that fat's not the enemy and it's our friend, I think that more people will benefit from using fat fuel. So we still have things to learn, but while we're learning, we don't have time to wait to get all the studies done. We need to heal people today. And we have enough anecdotal evidence and trials that are saying this is the best way to go for most people. Yeah,
I really like that tanker analogy. I've sort of used clumsier versions of that. It was basically saying, you go to the gas station, you fill up your tank, and then instead of using that, you stick a cork in it and then just like pour gas in your tank. That's much more. I like that one better. I'm going to have to start using that. But it's so true. You have all this stored energy and you're just not accessing it. And then you go into this lesser tank and it's much less efficient. You have to fill up much more often. It doesn't make any sense. It is a much better way of just living your life. A really interesting way of looking at this was from Dr. Mike Lead, I believe no relation, and at the Metabolic Health Summit in San Diego last year, and he sort of said, hey, why don't we sort of flip and look at this in a different way? We look at 9 calories per gram in fat. Oh my God, there's all these calories. You're going to put on fat. You're going to store all this energy. But obviously calories don't weigh anything. This is a measure of heat energy, and we don't burn things. We're not a combustion engine. We're not a steam locomotive where we burn these things. We're chemical factories, and we use chemicals. And he sort of flipped it on his head and said, well, which of these calories weigh less? Because atoms have weight. Matter has weight. Calories don't have weight. Room temperature glass of water and a water heated up to 89 degrees weighs the same. It has more calories, but it weighs the same. And so what he said was that fat has 1 gram per 9 calories, whereas protein and carbs have 2.2 grams per 9 calories. And so you have to eat more weight. You have to put on more mass and more matter to get the same amount of calories. And obviously this doesn't go into the whole fact that amino acids are used as structural components and proteins and all these sorts of things, and the hormonal influences these all have. But just looking at this from just a gram perspective, there are less grams per calorie in fat. So it's a more efficient fuel as well, and you put on less weight as well. And so it's sort of an interesting way of thinking about that.
Awesome. Thank you, guys. That makes so much sense.
Thank you, Emily. A huge shout out to
Emily.
Emily. Emily's channel is Inner Clarity System. The link is in the description below, and she's done so many wonderful interviews, really helping the hopeless for sure. Really inspiring stuff. Thank you so much, Emily.
Bye.
Talk to you later. Bye. Awesome. All right. Up next, Mr. Todd Bachnes, the Carnivore Cure. How you doing, sir?
How you doing?
Good. How are you guys?
Wonderful.
Good.
We're good.
Thanks so much for having me on. I just ordered that book. I'm really excited to get it. I've been thinking about that a lot. I was talking to Carrie about some of these things we're trying to connect the dots on, mentally speaking. Yeah, so I guess I'll just give a little story or about my story here and then ask my question. But yeah, long story short, I've bought weight my whole life, real extreme weight. When I was 14 years old, I weighed 600 pounds and fought it my whole life, and at my peak when I found carnivore, I was north of 715 pounds. I was immobile for over 2 years. I had congestive heart failure. I just had COVID that caused congestive heart failure. I was on 5 liters of oxygen. I couldn't get out of that chair. I was stuck in that recliner for over 2.5 years. But I had suicidal depression and anxiety, and I was fighting that real bad. Have had anxiety, since I was a kid, and depression since I was a kid. And thank God I found carnivore. Started off as keto, but went to carnivore, and that was a miracle for me. It got me off everything. It's like I had reactive airway disease too since I was 18. It just healed everything up. I'm down 262 pounds as of today. Got my mobility back. It's only been 12 and a half months, by the way.
Yeah, wow.
Completely off. I'm on no medication. I had my calves, both of my calves were over 36 inches in diameter with edema, and completely, that's almost completely gone now. That's one of the last things, but I did it for weight and health, obviously. But what I wasn't expecting was only 2.5 weeks into carnivore, my depression and anxiety disappeared like it never existed. And I could not remotely figure out, like, that was the first time that it dawned on me. And I got mad. I got real mad that nobody had ever told me this before, because I spent a lot of money and a lot of years at doctors, and nobody ever said all I had to do was eat ribeyes for 2.5 weeks, because I almost took my life twice in my life, very, very, very close to it. And I've lost 3 friends to suicide in the last 18 months. And it drives me crazy. But so that part I get, and just from being in this community now this long, I know that anxiety and depression goes. But during my weight loss journey here, I had been doing OMAD for about 9 months. Well, at about 7 months, I had started under eating, because my old diet mentality was trying to push me to get the weight off quicker. And I stalled out. My my energy crashed, and That was when I found the Steak and Butter Gang and I started doing priming, which was great. I haven't hardly lost any more weight since priming, but I went down 2 shirt sizes. I feel amazing. But one thing that happened when I started priming and my body started healing, and this is my question, is I was terribly addicted to gambling my whole life. I had a very addictive personality. Everything was 110% or nothing. There was no middle road for me on anything that I did. I was addicted to nicotine. I was addicted to caffeine. I was addicted to sugar. I had an extremely addictive personality. After priming and doing carnivore, that's all gone. I even chewed Copenhagen for 26 years, 2 cans almost a day for 26 years. And I wasn't planning on quitting. On carnivore, my body didn't want it anymore. It told me I was quitting. And I quit cold turkey after 26 years of nicotine. I mean, I had such a bad nicotine habit, I'd have to sleep with it in my mouth or I couldn't sleep.
Wow.
I had to sleep with chew in my mouth or I couldn't sleep. And after 26 years, I quit just last October 26th, and I don't have a single craving for it at all.
Wow.
And so I don't understand, but it's almost like the severe, I had like crippling anxiety. I worried. I mean, it was just like a constant tormenting agitation all the time. And I could never concentrate on any one thing. Everything, I just felt behind and out of, like everything was too big, behind, didn't have enough time to do anything, couldn't focus on anything. That seemed to always trigger me to have a very addictive personality to do something, and even on past weight losses, I've lost over 300 pounds twice in my life before and over 200 pounds twice in my life before, just not eating. I'd just starve because I didn't know what else to do. But that was my personality. Everything was 100% this way or 100% that way. Like there was nothing in between. Now that's completely gone. I don't have any compulsive whatever. This is the first time in my life that I quit gambling, several years ago, but it was only on carnivore that the urge went away, that the monkey wasn't on my back anymore. On carnivore, the food monkey wasn't on my back anymore. When people say, how do you know you're not going to gain it back on carnivore? And I'm like, it's simple. Every diet I've ever been on in my life is like one of those movies where you're hanging on by the skin of your, fingers on the edge of the building and you're about to fall. You're losing that's what every diet was like. This diet, I wake up, I don't think about food ever. I could care less. And when I do crave something, it's ribeye, and I can eat all that I want. And I only get healthier when I do it. I'm growing hair back that I lost when I was 22 years ago, and my hair's growing back, for crying out loud. It's like, I don't understand it. But my question is there a link to compulsiveness and addiction that's basically, is it driven by hormones? Is it, because my testosterone was terribly low before too. My total testosterone was 237. So was it hormones, or what is that link, or was it the anxiety that was making me? Because I know the anxiety was the worst trigger, but it's all gone. I mean, I can't even believe how free I am. I'm not addicted to anything for the first time in my life, and I'm 40.
That's me. Can I jump in and say something? So wow. So congratulations, and just so happy for you. It's just miraculous, right? When these kinds of things happen. So we're still trying to understand there's going to be a very powerful connection between compulsions, addictions, people being interested in alcohol, in nicotine, in gambling, whatever the addiction is. A lot of that, and when we think about it, for years, even before I started studying nutrition, I used to say to my patients who were struggling with addiction, because a lot of people do have an addiction of some kind, and say, people aren't stupid. They do things for a reason. Like they start using these substances. Sometimes they start using them because they're experimenting when they're in high school or whatever. But what keeps people using substances is the substances are useful. They're doing something important. They're stabilizing or balancing something that is dramatically out of balance and needs to be corrected. So, and that's how you can end up with, people, on uppers and downers, and sleep medicine at night, and some stimulant in the morning, and something to relax in the afternoon, and all, and antidepressant and a mood stabilizer, and one thing after another gets piled on. You're trying to stabilize something that's out of balance. And when you change your diet in these very particular ways, when you give the brain everything it needs, and you stop giving it things that are destabilizing your brain chemistry, sort of burning out your dopamine circuits, and causing inflammation and oxidative stress and all kinds of damage inside the brain, and disrupting your GABA and this balance in the neurotransmitters in the brain, GABA and glutamate, sort of the brain's gas pedal and the brain's brake pedal. All of that is thrown off when you're not eating the right way. If you're eating the right way, your brain's operating system changes. The cells start working properly, everything comes into balance, and you don't need that outside stimulation anymore, because everything's okay. And so, like, I noticed for myself when I did pure carnivore, and which I don't do right now, though I'm heading back in that direction gradually. I'm probably 95, 98, depending on the day, right? But there's a huge difference, and I'm curious what you think. There's a huge difference between even almost carnivore and actual full carnivore. There's a big difference, and huge. And I think a lot of people don't appreciate that. It's not there's a cliff that you drop off of when you leave carnivore and go to regular keto. So I've struggled with food addiction my whole life, and weight and things like that. The only diet that has ever completely quieted my sort of preoccupation with food, that's kind of what am I going to have? What can I have next? I wonder what I'm going to, that sort of little voice that's there. Keto works wonders for that voice, but it doesn't completely quiet it. Only carnivore completely took that voice away. I used to think that was just who I was. So, this is the thing, is that these addictions, I think they're there for a reason. They're serving a purpose. And now you're giving your brain everything it needs, and you've stopped injuring it with these things it doesn't need that are damaging. So your brain's okay now. You don't need those things anymore. I think it's just amazing. Your story is just amazing.
Yeah, I was just sorry. No, go ahead. Go ahead.
I was just gonna just add to that. Just when I see patients in clinic and they are making these transitions, they say similar things, that it doesn't seem to bother them as much. And part of what I've seen is that it's almost like when people struggle, I say, try to stay away from that stimulus. So if it's a Dunkin' Donuts, just take another route. If you got to drive by Dunkin' Donuts, just take a different route. And what I learned from Dr. Joan Iflin is that those addictive neurons, they're kind of hanging out. They're still there. They're probably hanging out at Dunkin' Donuts. So if you stay away from Dunkin' Donuts, they may not. And I think you clean your diet up so well that you've made your house a safe space. You've made, maybe what your work environment a safe space. So what happens is, I think your body is first of all, it has the proper fuel, is doing just fine. You don't have all of those stimulants that normally would trigger you, and you've removed them from your life. So even in a setting, when you finally get around those things, you're so kind of satisfied that you're okay. But I would dare, even today, I don't keep like peanuts on the counter. We have a rule in my house: don't have peanuts on the counter, because that's a trigger, because I used to love peanuts, right? So even in my carnivore life, I don't want to see peanuts on the counter. So I think you've just cleaned up so much. You've removed the Dunkin' Donuts, or you're going a different route, and your body is like, I'm good now. But if you were to eat a little bit of those things, as suggested by Dr. E, that may put you on a different cliff, a different situation that may then put you back on that rabbit hole. So I just think that's a theory, but I think that's part of the explanation.
I gotcha. Yeah, I was just gonna say that I did 2.5 years of keto before I found carnivore, and it did not work.
Yeah.
It was the depression was there. That's why I didn't think depression or anxiety had anything to do with diet. And with 2.5, I mean, all I was eating was ribeyes. And within 2.5 weeks of just eating ribeyes and butter, it was gone. And I mean, I even down to the point that I had to get rid of black pepper. You know, I thought, oh, this couldn't be hurting anything. I got rid of black pepper, and it was like a switch turned, and every craving that I was just completely dominated by was gone. It was just gone. I mean, so yeah, you definitely get that. I would say this though, I think it's even more powerful because I wasn't able to clean up my environment because my mom, I take care of my mom. She's got dementia, and at the time now she's carnivore, but she was eating like a dumpster fire. So there was brownies and cake and soda and pizza and everything all around me, you know, when I was going through that. So I feel almost impervious to cravings now because I the only thing I'm addicted to now is feeling good and not having any addictions because life is so much better here, you know. So
I love that. I was going to say, Todd, I experienced the same thing, no addictions. And there's something really liberating about that I never expected going into carnivore. It's really amazing not having any addictions whatsoever. So
yeah.
Thank you, Todd. Todd's at the Carnivore Cure. He's got an awesome YouTube channel. Helped out Bill Not a lot, doing some really good interviews over there too. So everyone go check out Todd. There's a link in the description below. Thank you, Todd.
Appreciate it. Thank you so much.
Todd.
I was just gonna add to some of that as well. It was just to say that you know, I've noticed that as well. What Dr. Eid said, there's a big drop off from carnivore to keto, and that's I mean, people always say to me is that, wow, you're so disciplined and this or the other because you only eat meat. I'm not disciplined. It takes zero discipline to do exactly what you want to do, and I have absolutely no interest in doing anything else because there is that drop off, and I don't like it. And so even when like spices, we got some like, you know, biltong, and which is like a South African sort of dried meat. It's delicious, but when they make it, if I don't make it, there's like these little seasonings on it, and I had some of that. It made me feel like crap for the rest of the day. I'm like, okay, I don't want that anymore. And even though it's delicious and it's almost entirely meat, just with a bit of spices, it didn't make me feel good, and so I don't want it anymore. So even that meat, I'm not going to eat that because it has some spices in it. And so, you know, that's why I sort of tell people, like, you know, that getting with those last 5% of vegetables and plants gives you 95% of the benefit. It's such a huge difference, and that's really amazing. You just ate pepper, and that or took away pepper, and that made such a big difference. You know, I've seen very similar things too, and I do know of you know, some studies that, like in alcoholism, when people are like detoxing from alcohol in a hospital setting, that you know, different sort of groups, when put them on a ketogenic diet and just a standard diet, the ones on a ketogenic diet actually had an easier time withdrawing from alcohol. Subjectively, they said it was easier. They didn't have as many cravings, but also objectively, they needed less benzodiazepines to keep them out of the DTs. And so that there's something going on there, as Dr. Eid said, where this is affecting your neurotransmitters and receptors that in a positive way, that's allowing your brain to work and function normally, so you don't need these substances in the first place to normalize yourself, which I think is amazing. And it's just something that it'd just be very interesting to see, you know, where that comes in the literature, to find out the exact mechanisms on how that works.
Absolutely. Yeah, it was nothing short of a miracle for me. I didn't see it coming. It just happened, you know. But
yeah.
I sure appreciate it. Thank you all so much.
Thank you, Todd. Have a good night.
Yeah.
All
and,
right.
and Tony, like you talk about the peanuts on your counters. If my parents do carnivore, they've been doing carnivore for maybe 6 months less than I have. You know, they sort of came on a bit after that. Same thing. You know, my dad just will just, if there's something sort of there, if there's like almonds or something like that, he's just used to just grabbing some almonds and eating them, and like he just doesn't even think about it. It was just sort of grab them. And I mean, we were at a family function sort of within the first year that I sort of went on this, and my mom was putting out some like veggie platter. I mean, why would you? But she did. And, you know, for other people to eat. And I remember just sort of walking around, you just automatic habits. I just picked up a piece of cauliflower of all things and just started putting it in my mouth, started chewing it. My mom's eyes went wide. So I kind of like what? And she's like, "You're eating poison." I'm like, "Oh God." When I'm like spitting it out. Like, it was just this automatic thing. You don't even think about it. now I don't have those automatic reactions anymore, but it's so easy, especially in the first little while, that you just see something. Oh yeah. And you just go into automatic pilot, and you just grab a handful of peanuts, you grab a handful of almonds, you go cauliflower. Like, why eat cauliflower? It's like, it's never been appealing to me. It was just something to do, and you're just used to doing it. And so, yeah, it's very interesting when you get out of those patterns of addictive eating, where you're eating for the sake of eating. You're eating because you're bored and you want that sort of that tactile experience, as opposed to like you need food, which is very strange that we gone into, that we can even get into that in the first place. But it's very nice to be outside of it.
Yeah, absolutely. And it's like going to the theater. It's hard to go to the theater without popcorn, right? I mean, it's a big. I know you're in the theater, Carrie, and thankfully you have some, carnivore snacks. It's hard to go to a Cubs game in Chicago without getting a hot dog, right? So it's just social, it's cultural, and I think once we kind of change the culture, and we've done that in our family, so we kind of know what that plate's going to look like. Is different, but it took years to get to, and it started with the emotion of my mom being upset because I'm not eating her dressing. I mean, she really was like, you can have a little, because she put love in that dressing. So it takes a while to get past that. And now she knows I don't want my baby. She still calls me her baby. I don't want my baby to be sick at night holding his stomach, because if I eat her dressing, I'm going to be up at 2 a.m. So she's kind of compromised, and that's where we are, but it takes time.
Yeah. Let's say, Carrie, with your movie theater, you poisoning people with popcorn, or what do you guys
I love that this came up. Yes, but we have pork rinds and grass-fed beef sticks. But I love that you said that, Dr. Hampton, because that was prior to carnivore. Every single night I tried the popcorn because I wanted to make sure it was good for the customers. So I've had to physically restrain.
Yeah, that's why. I just want to make sure quality control. Just want to make sure for them,
right?
For them,
right?
Yeah.
I haven't had a single kernel of popcorn in 315 days now. So,
cool.
But
nice.
it is hard, man. It smells good still, but
well, it's the butter that smells good, though, right?
Right.
So just drink the butter. That's fine.
I know how I'll feel if I have any of that popcorn. So.
I love drinking butter. What's up, everybody?
Hey, buddy.
Speaking of drinking butter, JT, welcome.
Let's go.
Yeah, JT.
Nice seeing you again, Dr. Chafee, Dr. Tony, and nice seeing you, Dr. Eid.
Hi.
Hi.
Good to see you.
I love the hat.
Thank you. Thank you. Just a brief background on how I got to carnivore. I was in the music scene, and along with that comes a lot of bad decisions. I was going to a lot of parties. I was drinking a lot. I was smoking a lot. I was eating all the bad foods. And that led me to having terrible, terrible IBS. And I couldn't even perform anymore on stage without my gut just feeling horrible. And I could tell that my gut problem was leading to depression because I felt so alone, like there's hundreds of people, having a good time. They're dancing to my music, and it felt good, but it felt like nothing when I felt like crap, and I felt alone up there, and I had to quit. And I left that whole scene. I left all those old friends, and it kind of got worse because I was just by myself then. And I said, I got to do something. So I quit the soda, I quit the beer, and I started losing a little weight, but I still was just terribly depressed. And my life ended up being in a tub. I was just in the tub all the time with my stomach and my back. I have 3 discs in my back. They're out of alignment from a prior accident. And so I always just had to lay in a tub to feel good. And I suppose the eating the food wasn't helping and all that, but I got to a point where I was just living in this tub and my world was so small. And I don't feel like that word depression really can describe how dark of a place that me and other people have been in. It's just a word, and it never can describe how dark things can get. And luckily, though, my coach says that the worst things that happen to you in your life set you up for the best things that ever happen to you. And I'm a firm believer in that, because I found carnivore and I was subscribed to Carrie's channel, and I saw him start doing carnivore, and he was jumping around like a 7-year-old. And I said, wow, what the heck happened to this dude? He was huffing and puffing in all his videos before, and now he can't sit still. So I said, I want some of that action bad right now. And so I just cannonballed right into carnivore. And the first 7 days were kind of rough with the cravings. I wanted everything. I wanted Kit Kat bars, you know, I wanted Pizza Hut. It was terrible. But after I got through that first week, I felt so good. And then after my first 30 days, on day 27, I stopped smoking cannabis. My sleep apnea went away. My IBS went away. My depression went away, all within the first 30 days. I was a completely brand new person by the next month. And it just, I'm just forever grateful for hearing about the carnivore diet. So that's why I appreciate all of you on this panel right now for helping get that word out, because I know it's going to change someone else's life and they can get out of that dark cloud that some of us live in with depression and anxiety.
Thank you. JT, do you think, should we tell them what we did this weekend too? Do you think we would have done that while we were depressed?
No, yeah, I wouldn't have felt good enough to even make the 2-hour drive to you. I would have needed a toilet every 15 minutes, man. I'm just, you know.
Just real quick, JT and I, this on Saturday, he came over and we went knocking on doors of strangers' houses, asking if we could go inside and cook them a carnivore steak dinner. And we just did a video. The video's out on the channel. So it was entertaining, right, JT?
Yeah, it's our second family that we found that they're crazy enough like us that they let us into their house. We cook them a steak dinner and we get to make a connection and meet these people and put them on to how we're feeling, you know, because when you feel so good like this, I feel like you want other people to have the same thing. And that's important to me to share that.
It sounds like the beginning of like a true crimes episode or something like that. You know, these people would like get in their house and say they'd cook them a nice dinner. When they got in, they tied them up and killed them.
Yep.
We did a live stream just before Dr. Chafee, and I said at the end of the live stream, if you don't hear from us in like 3 or 4 hours, send someone looking for us.
Yeah, so maybe check the jail. You know, for going around
Very
getting
sweet
arrested
family,
for
though.
suspicious behavior.
They were great people, and it's so worth it because Azael, the guy we met, he wasn't feeling good, and he started kind of like me. He started cutting out the alcohol and the soda, but he's not feeling good. I was like, that's because we're still eating the junk, brother. Like, you know, you can cut out alcohol, you can cut out soda, but if you're still eating the junk, you're just setting yourself up for failure, in my opinion. So we have to, you know, and carnivore totally helped me change my paradigm. You know, you were talking about grabbing the pecans and stuff. Like, I don't have those types of cravings anymore for any junk. And it's so liberating. So, and it's a paradigm shift that needs to be made. And without changing your paradigm, you're just going to keep having those same routine actions that you always have, you know, eating to eat and sabotaging yourself with how you feel.
Absolutely. All right, JT, do you have any questions for the panel?
Absolutely. Now, before I ask my question, I have to put on the proper hat.
Oh, no.
This is my dad's hat, Dr. Tony. I put it on for you, buddy.
I appreciate you, man.
My question I had, you know, it's important to me because I feel like my gut health led to my depression. And so I just wanted to ask, how does gut health relate to mental health? And how can nutrition impact that relationship? Because it's so important to me. I feel like that's what led me down that road. So if you guys could talk about that, that'd be awesome.
Yeah, I think all three of us will have something to say about that. It's you know, that's your first defense. Your gut lining is your first defense against the outside world. And so when you swallow a food and it goes down this tube through your stomach and then this tube, it's still not in your body yet. It's still outside your body when that's inside. So and then the cells that line your intestines and the microbiome too helps with this. They break down the food and then they decide what's going to get in, what should stay out, what needs to just keep traveling along towards the exit, right? So that's your first barrier, and it also the membranes and everything's got to be nice and healthy for this to work properly. If your gut isn't healthy, especially the lining of your gut isn't healthy, then the wrong things are going to get through. And so you're going to absorb things that you shouldn't be absorbing, and you might not be able to extract everything from food that you need. So you might not be getting in everything you need, and you might be getting too many things that you don't need crossing, that is basically your defenses are breaking down. So then everything can just kind of wander in willy-nilly into your bloodstream, and the blood flows through the brain, and as these potentially risky molecules that aren't supposed to be getting into your bloodstream, they're circulating through your brain, they can damage the blood-brain barrier, which is supposed to protect the inside of your brain from anything potentially risky that's in your bloodstream. So anything that can break down your gut lining can also break down the lining of the blood-brain barrier. So just everything kind of becomes, you don't have your natural protections in place. And then, the other thing is that, and this is, I think, less well understood, and it's not really the focus of my work, but the microbiome too plays a role in breaking down your food and deciding, it's a part of that barrier. And if you're not eating properly, parts of the microbiome, the wrong parts can die off, and you can get this imbalance in your gut bacteria that could also be playing a role, in how you feel. And everything is communicating with everything else. So the microbiome and every part of your body is communicating with the brain with chemical signals, and directly through the nervous system, through this giant nerve, the vagus nerve that connects your brain to your gut, and through hormonal signals and neurotransmitters. So everything is sending a signal to your brain saying something isn't right here. And if you get inflammation down here and all kinds of things down here, you will also have it in the brain as well. So everything's so connected that it's difficult for the brain to be healthy if some other part of your body isn't. So a lot of people who have gut issues also have brain issues. There's a really strong, these often go hand in hand, and it kind of makes sense that they would. And I think there's still a lot to learn about this, but so many of my patients will say, well, my depression began after a course of antibiotics, or my anxiety began, after I had that gut surgery, or whatever it was. That the gut seems to go first for a lot of people, but that's probably not enough of an answer. Other people want to chime in with other pieces of the puzzle.
I'll just add, now having the same gut problem that you had and Carrie had, we all are kind of brothers from another mother, and it was not very fun at all. Always, you kind of joked about taking that trip, but honestly, when I took trips anywhere, I had to think about the bathrooms. That was like what you had to do. If I was speaking somewhere, I had to think about the bathroom. So it was very frustrating. So I've always been intrigued by this question as well. And when I was doing my vegetarian years, for about 8 years or so, I was really trained that those short chain fatty acids, which are basically, your microbiome actually, produce fermentation products from fiber that'll then help protect your gastrointestinal tract in theory, although we know fiber can irritate your gastrointestinal tract. Yeah, but if you think about something like beta hydroxybutyrate, which is one of the ketones, if you're in a ketotic state, you're likely to have an abundance of that. So it kind of helps to explain why the microbiome, which may be completely different for a person who's plant-based versus a person who's more carnivore, but it doesn't matter because that carnivore is getting all of this short chain fatty acid, which is protecting the lining of the intestine anyway. So, because I always was intrigued by why is my belly so much happier with the ribeye and the ground beef and things like that. And I think part of the explanation is that you're getting short chain fatty acids, not from fiber and fermentation, but you're getting it from your diet. So if you can get it that way, let's cut out the middleman and just put it in the gut that way. And I think so again, we're still learning, we're still growing. There's not a ton of research that we can lean on in the microbiome space because some of that research is not in the test tube, it's not done on humans. But for me and what I've seen in my research, when I was asking the same question, that's what I kind of came to the logical conclusion is that we get our short chain fatty acids from a different source than the person who's eating fiber. And if I eat fiber, thank God we're virtual, right? Because there will be a problem in that. That's my thoughts on that topic.
Appreciate it.
Yeah, I mean, I'm not too well versed in the sort of the gut-brain connection as far as, serotonin, the different neurotransmitters and things like that. But I don't know if that's something that Dr. Ede knows more about. But just exactly the same sort of thoughts that both Dr. Ede and Hampton had, which is, you're going to see problems in your gut first and foremost. If you're eating the wrong thing, you're going to get upset stomach. You're going to have these sorts of manifestations in your GI system first when you're eating something inappropriate, and then that of course is going to have knock-on effects into the rest of your body. And so if you're eating the wrong thing and that's damaging your gut, that's going to get chemicals into your body that's going to damage the rest of your body. You're not going to be getting specific nutrients that you have to have for your brain and your body. You're going to get harmful chemicals that can get in, either be they man-made or nature-made, that can harm you. I mean, I harp on about the different sort of defense chemicals that plants have, because this is something that should not be ignored. This is something we've known for millennia. We've known about toxins in plants. We killed Socrates with hemlock. We had different sorts of poisons from plants. We knew these things were toxic, and we had different ways of reducing the toxic load in the food that we ate, by fermentation, by cooking, by different sorts of processes like nixtamalization for corn. All these different sorts of things that we did, and we've just completely thrown by the wayside because all plants are good. Everything's perfect if it's a plant. Of course, that's wrong. And so we need to be aware of that. Plants make about 1 million different defense chemicals, and we need to be aware of that. And they exist in spinach as well as in hemlock. But we've also patented about 1 million different novel chemicals since the 1970s. What the hell do these things do? And what are they going to do to our bodies? So, just eliminating out all these different sorts of random chemicals that may or may not be appropriate for us. You just cut out to basics. Just put in your body what is designed to put in your body. Try to keep everything away as much as you can. And in general, that's going to improve your health and your mental health as well.
Absolutely. So what I'm hearing is, you change your gut, you can change your life. Absolutely. I appreciate those answers, because that gut health is just, it's been one of the biggest things for me to overcome. It had me in such a low vibration all the time that I feel like I finally conquered that. And just quick question, Dr. Tony, did it ever get you kind of anxiety or depression with your gut health, or is that?
I think it was like, I was fortunate. I think I had more anxiety when I had a lot of real estate and things weren't going well. but in terms of like my diet, I didn't. Again, it goes back to what I said earlier. I don't think I realized that I wasn't as in a good mood, or I was struggling mentally, because I thought it was norm. So, but once I started to eat this way, how I interacted with my team was different. How I interacted with my spouse and my kids was different. So I think that it was at like a very low level depression that I think we all kind of suffer through, because life can be challenging. And then I'm just like a, beep beep. I'm like the, Bugs. I'm just a completely different guy now. And so I think that's my version of it. And I can't explain how, you just feel like you've been freed somehow. And I know Carrie talks about this a little bit, and you're just able to give the world so much more of you. And it makes you feel so good. And I can be a better husband. I can be a better father. I can be a better, director and leader in my health system, better doctor. And when patients see me, if I'm not that person, they notice immediately, because they've become accustomed to this energetic doctor who's delivering and giving all this information, talking about nutrition and all the other things we need to talk about. And I want to continue to deliver that, not only for their benefit, but for my benefit, so that I can actually continue to do this work and don't feel like it's a burden. And I just love, so I appreciate that question, and I really appreciate that Bears hat. That's really what it's all about.
Well, I suppose now you're feeling better. You can handle a bad season from the Bears. You're not gonna get as mad.
Yeah, that's pretty much what they expect, but we're gonna hang in there.
No, I love giving you crap, and I appreciate the whole panel and you guys taking time to hear my story and answer my questions. I really appreciate you guys. And
Before
Let's
you go,
go.
JT, I've got a question for Dr. Eid.
Yeah.
Sure.
So you commented on his hat before that you liked it. Can you comment on the new one?
I'm pleading the fifth here. I don't, if I don't see cheese on your head, I'm not talking to you.
I'm a Packer fan. This is my dad's hat. He's from Milwaukee, but
You're a
he likes
Packers
to give.
fan?
Yes, my dad is. He was born and raised in Milwaukee, but he's a Chicago Bears fan because he likes to fight with everybody in the state of Wisconsin. So I told him, I said, let me borrow your hat. I'm going to be having Dr. Tony, getting to talk to him. So I said, I want to give him some crap and have some fun. So, but I appreciate you, Dr. Eid. Nice meeting you, and Dr. Tony, Dr. Chafee. Appreciate you guys. Adam.
Thanks. Thank you, JT. Shout out JT.
Appreciate
There's
you.
a link in the description below to JT's channel. Poco Moonshine Family is doing a
Yeah.
lot of good interviews with other carnivores. See you, buddy.
Let's go.
Take
See
care,
ya.
buddy.
Bye.
Mhm.
Awesome. We have one more guest. Jeff DeProsperous. How's it going, sir?
Yeah.
Very good. Can you guys hear me?
Yeah.
Yep.
Looking good. Sounding good. How you doing?
Awesome. Thanks. I'm doing all right. A little bit of a panic. I had a little bit of technical difficulties, and I had a busy day. But I'm here, and I've listened to this entire event on and off with my technical difficulties the entire time. So I just want to say hi to Dr. Eid. It's a pleasure meeting you.
Likewise.
I haven't ventured into your book yet, but it's on my read list now. So thank you for having me on. I want to say hi to Dr. Hampton and Dr. Chafee. You're like my two favorite YouTube doctors. So I'm really privileged to be on with you guys. And once again, and Adam and Carrie, you guys are my YouTube best friends. You guys know that. So thank you. Thank you for having me.
Oh, nice.
Absolutely. Yeah. Thank you for coming, Jeff. We're looking forward to hearing your story.
All
Yeah,
right.
definitely.
Is it my turn now?
Yeah, absolutely.
I just want to say hi to my subscribers too, because I was trying to get this stream from my channel, and I don't really care as long as it's being streamed from somebody's channel, right? And it was on everybody's channel because we just got to get the message out. But just apologize, and I was trying to, and I told them in a panic, just tune into Carrie or Adam's channel to catch this, and we're smooth sailing now. So I just want to say hi to my subscribers. I'm going to introduce myself a different way. I know Dr. Anthony Chafee knows, and Tony Hampton knows I have a new mantra. So I introduce myself a little bit different, Carrie and Adam, but to Dr. Eid. And I'm not going to do it like the way I normally do it, Carrie. I'm going to introduce myself as a human being. My name is Jeff DeProsperous, and I am a father of two sons, Peter and Dante. They're teenagers, 15 and 13. And I have a beautiful wife that I've been married to for 24 years. We've been together for 24 years. We've been married for 17 years. I have a mother. I have a sister. My father just passed away like 4 months ago. I am really tight with family. I love my family. I've been a high school phys ed teacher for 21 years. I am a former varsity soccer player. So I really relate to Dr. Anthony Chafee because he's a big time athlete, and I always wanted to be a professional athlete. I played university soccer for 2 Canadian universities. In my graduate year as a teacher at one of the universities, we won a national championship, best team in Canada, and I was very privileged to be on that team, and I was rewarded an academic All-Canadian playing on that team. I'm very passionate about, I have a kinesiology degree, 4-year kinesiology and physical education degree. So I'm very passionate about health and fitness and well-being, and I always have been. Like I said, I've been a phys ed teacher for 21 years. And in terms of me venturing onto the carnivore diet, that happened about 22 months ago. I was diagnosed with a disease that many people classify as a genetic mutation, but I've heard you guys talking about metabolic diseases, and that's exactly what I believe my disease is, a metabolic disease. So I've been approaching it that way through the helps of many friends of mine. In particular, a shout out to my very close friend, Dwight Garlow. I call him Medicine Man. He lives very close to me in my hometown. He's a friend. He's a coaching colleague. And through the helps of Carrie, especially Carrie, I've been able to connect to the YouTube world. And I'm very, very blessed to be connected to the YouTube world. And all these doctors that I've been following for the past 22 months while I've been a carnivore, such as Dr. Anthony Shafee, Carrie introduced me to Tony Hampton, Sean Baker, a whole bunch more, Ken DeBerry, even Dr. Paul Saladino, even though he drives me a little bit nuts when he eats fruit. So I always shout out to him. But Carrie, I'm very blessed to have met him, and even Adam, and they've made me part of their documentary that I think we're all really excited for coming out, Healing Humanity. And yeah, so I've been a carnivore for about 22 months because I have stage 4 colon cancer that has fully metastasized to the liver. The diagnosis was kind of shocking about 24 months ago in April of 2022. I was deemed inoperable, incurable, terminally ill, palliative, given months to live without treatment. With treatment, I think Sean Baker reminds me all the time that if you Google it, it's 9 to 12 months with good treatment. But here I am 22 months later. And in terms of mindset, that plays a huge role in my treatment today, part of my regimen. And I did struggle with a little bit of depression, anxiety, and sleep apnea right before I diagnosed myself. But there's also things here in Southern Ontario, Canada, where I'm from, that have affected me probably for the past 15 to 20 years. Everybody knows of SAD, seasonal affectionate disorder. I've been a victim of that probably for the past 15 years, and it's probably many reasons. I'm not a big fan of winter, but also the lack of vitamin D. I've realized that I do supplement with quite a bit. Even though I am a carnivore, I do supplement because my medicine man, Dwight, says the chemotherapy that I've had, 38 rounds of chemotherapy, really depletes all my cells of all the special vitamins and minerals that normally partake in a cell. So I'm trying to attack this the metabolic way, where the mitochondria has been disrupted, and I'm trying to fix that mitochondria. So Dr. Eid and Dr. Shafee, Dr. Hampton, I hope I introduced myself enough. Sorry for talking so much there.
Well, that's an amazing story, man. Every time I hear it, it's just more and more powerful to me, and I really appreciate you making your channel and putting yourself out there for other people to see, because I was literally just talking to someone today, and they were saying that their father-in-law has a stage 4 colon cancer, and basically his doctors are saying, there's nothing you can do. Food doesn't matter. Just drink beer, eat chicken wings. It doesn't matter. And it's just like, why would you do that? I mean, even if you didn't understand about this stuff, why would you tell people to be unhealthy and do things that are knowingly unhealthy? Of course, that's going to give you a worse outcome. Of course, it's going to make your body less able to fight this thing off and to weather the chemo and radiation. So it's pretty appalling when you hear that. And so I really appreciate you coming out and telling your story so that people can look at that and go, hey, there is something I can do. They don't have this defeatist mentality from their doctors sometimes that probably has their best interests at heart, saying that, look, this is a really bad situation. Just enjoy your life. Have beer, have it. But people aren't asking, hey, does food matter? Because I really want to go and party. And that's what I want to do. That's not what they're asking. They're saying, does food matter? Can it affect my outcome? Can I help this get better? But, some people hear that and say like, yeah, just go party, go to Ibiza and just go wild. It doesn't matter. It does matter. And so they hear that and they go, there's nothing I can do. This is hopeless. And so, I think you give a lot of people a lot of hope. And so I appreciate that.
Thanks, Dr. Shafee. And I hope that person you were talking to is listening tonight, because I just want to say to them, the doctors kind of told me that too. Have a beer when you want to. Eat what you want. They told me all that right from the start, a few of them. So I didn't really listen to them. And Carrie Mann always says you got to take things into your own two hands. So that's what I'm trying to do.
I'm curious, Jeff, if you could just briefly speak to not just the fact that you've added all of these months of life and all of this time with your family. And I can only imagine, I've seen your channel and the things you share, but could you just speak a little bit about not just longevity, but the quality of your life, what it's like to eat this way and what it means in terms of what you can do now that you most people in this situation, if they're here, can't do.
Yes, that's a very good question, Dr. Hampton. And I the word longevity, I actually was going to bring it onto Dr. Shafee's podcast tomorrow morning. It's morning for me. I think it's going to be night for you, Dr. Shafee. So I'm going to go to bed thinking about you, and I'm going to wake up thinking about you, and then we're going to be on. So the longevity thing, because I look at, and when you ask that, Dr. Hampton, I look at like not only, when I ventured into the carnivore diet for the purpose of healing me in terms of my disease, I started to really understand the benefits of living a life with longevity and purpose and meaning. So. I started, even when I listen to people like Sean Baker or Anthony Shafee, and they have, they talk about their workout regimens or their and why they're doing it. From a scientific point of view, it makes a lot of sense, and why all the regimens that I'm doing, it's helped me, and this is going to sound really weird, but even though I do have stage 4 cancer and I'm terminally ill, I've said this before, I'm in the best shape of my life right now. And I feel like I'm a varsity soccer player. I was talking to someone last night that's playing like in adult league soccer, and I'm like, I'm trying to get in, and I don't think people are inviting me because I think they're like, oh, Jeff's dying of cancer. I don't know if I'm ready to play. Like, as long as my port on my chest doesn't get, even if it does get out of bed, they can fix it. You know what I mean? I want to get on the pitch. I'm looking forward to it. I've been coaching a lot, volunteering. I'm still loving it. I would love to go back to being a phys ed teacher. That's my passion. But I'm blessed right now with the life I'm living with my family, especially my 2 sons. I'm very, very blessed that I'm in their life. Like today, Peter came with me, and by the way, this morning I had hyperbaric oxygen treatment out of town, actually close to Toronto, Canada. So it's about an hour away. So Peter wrote his last exam. He's in grade 10. He hung out with Dad today, and we went for hyperbaric chamber treatment. Then we went out for a carnivore lunch. And then we did a few things. We're sneakerheads, so we went and looked at a few shoe shopping at the mall. And then we booted home. I was able to drive Peter to then soccer practice tonight, and that's where I was kind of communicating with Carrie and Adam, and I made it home on time to be on this channel. So in terms of that's my longevity, like that's my life. That's what I'm doing day to day, and I'm not stopping. And the carnivore diet has allowed my mind to be very clear and focused and scheduled and regimented and disciplined. And then in essence from that, and I think maybe Dr. Eid could probably expand on this, because my mind is now so strong and I'm basing it a lot on the carnivore diet, my body's starting to respond to it too. And my energy level's steady. I think I'm in and out of therapeutic ketosis and just normal ketosis. I'm not carb dependent at all, because I avoid that a lot as much as possible.
What really strikes me is your ability to be in the moment right now, enjoying your life in this moment. I mean, for all we know, you could live longer than I do. I just don't have. Nobody's telling me how much longer I might live, just because you know what I mean? It's you've decided to live now, and to live your best life in the healthiest way possible, to be with your family, and to give them the best of you and to give yourself the best of you, regardless of what other information might be coming in from doctors and whatever other treatments you may be requiring. I think it's just really a huge testament to your character. There are so many people who, if they were faced with a diagnosis like this, would just give up. And how, what you've done is you've turned your life into this beautiful. I mean, I just am really, really moved by your story, because it really does say something about who you are. Because there are so many people who would just take that diagnosis and give up. And how does that help anybody? How does that help your family? All of us want to be our best selves, regardless of our health status or how old we are or what diagnosis we may be living with. I mean, I think it's just amazing. And you can hear the wellness in your voice. That's the thing. I mean, most people who have a serious diagnosis, a medical diagnosis, you don't hear that joy, that just love of life and love of your family in your voice like this. It's just, you can feel it. And so you're doing something right. that clearly, from looking at all these comments here in the thread, is really moving to people. Is really you're giving of yourself to others, everything you have. And I think that's going to be healing as well. I think it's really therapeutic, not just for everybody else, but for you too.
Thanks, Dr. Eid. Just listening to you, I tried to hold back there, because you got me a little bit teary-eyed, and Carrie's seen it before, but I held back and you made me smile. Thank you, Dr. Eid, for recognizing that. I see the world my eyes see the world as a different place now. And everything that, any stresses in the past, they don't affect me anymore. And I'm learning to just enjoy life and keep my cells healthy and calm. I'm trying my best every single day. So I think, and thank you for saying I sound and look pretty good. I think I feel good. I look good. I remember back when I first did my first video, and it was the 24-hour live event. And Dr. Shafee, you gave me, you spoke to me at that live event after viewing my video I sent to Carrie, and you said there's going to be people out there in the world that are going to try to go at you still, and negative people, and I just got to try to block those people out. And you know what? At the beginning of me, especially going off work, everybody was pretty empathetic, sympathetic. But now it's like, we live in a horrible place sometimes where people, like human beings, it's human nature to judge. And, there's even people I hear, and I try not to keep it in my head too long. There's even people at my school that think I'm faking cancer because I've been told this, because I look so healthy, and I'm going on vacation with my family, and I'm doing push-ups, and I'm exercising, and I'm doing this. And this is the kind of thing that, when we're here to talk about, depression, anxiety, and mindset, I remember what Shafee said, and I forget about those people, and I don't care about those people, and I avoid those people. right? Because I don't need those people in my life right now. And they want me, those people, I don't know if they want this, but I feel like they think I should be weak. I should have no hair. I should be withering away, losing weight, not being able to get out of bed. I think that's the stigma they put on someone that has the disease I have. So, you know, Dr. Shafee, I'll never forget that advice you gave me from the beginning. There's been the odd person on YouTube, my subscribers wanted, but Carrie said those people are probably like AIs. They're not even real people making comments, but mostly everybody has been. Not only am I helping a lot of people, I'm receiving tons of emails. Carrie knows it, like emails a day, messages a day, that I'm helping people with stage 4 cancer, which that's why I made my YouTube channel. And but it's good for me. Then they give me comments about, you know, how inspirational I am and everything, and it's good for my mindset. So I try to surround my world with all those types of people to keep it going. And Dr. Reed, I sorry, Carrie, is it question time now?
Yeah.
I think I drive Carrie nuts because I take over his job.
No, you're doing good. Go for it.
Like Dr. Reed, I've been trying to really work on mindset, and JT was just on, and I think he speaks of a coach all the time. So I try to bring these coaches in my life, and I've been listening to Bob Proctor lately, and that happens to be JT's coach, and he was all very excited about that. And that was just by fluke. I've been seeing a Wim Hof instructor who's working on breathing with me, which it's all connected in terms of like your brain and your nerves, and we're working on my vagus nerve, the fight or flight response, you know, cold plunging and stuff like that. Can you speak to scientifically, like, am I doing the right thing? Am I doing the right thing in trying to keep my, you know, the vagus nerve connects from your brain, I believe, throughout your whole body, and trying to calm those cells. Is there any more I can do to add on to that?
Yeah. So what you're doing is, you know, the brain is listening. The brain doesn't just listen to food; it also listens to every other aspect of your environment. And you're doing all of these wonderful things to improve the quality of every aspect of your environment. So you've got good relationships, good people around you. You're blocking out the people, you know, ignoring the people that are, you know, not so positive in your life. You know, you are, in addition to feeding yourself really well, you're learning how to manage stress and learning how to calm your nervous system. And this is really important because stress also has an impact on brain chemistry and mood, and even on the structure of the brain. Too much stress can directly damage the brain. And so the food isn't the only piece of the puzzle, right? You need love, you need, you know, joy, you need, you know, good relationships, you need, you know, healthy, you know, good breathing techniques can reduce the neurotransmitters in your sympathetic system, which is the fight or flight system, keeping everything calm. And that way your brain won't be overreacting and, you know, trying to fight off inflammation and oxidative stress that can come from high stress hormones. So this is also really important. And so it's wonderful that you're working with a coach, because these things are hard to do when we're all by ourselves, alone in a room.
Yeah.
You know, we're social creatures, and we learn from each other, and we grow when we are connected to each other, and when we feel loved and supported by other people. So that I love that you're exposing yourself to positive influences and getting coaching and taking good care of every aspect of your health, not just your diet. And I think it's really wonderful. You know, you just never know what's possible. All you can do is take care of yourself one day at a time and see how things unfold. And you know, you're taking care of every aspect of your nervous system by doing all these different things.
Awesome, thanks, Dr. E. Do you have any patients of yours that you work with that have cancer? And is that part of their treatment to try to keep their mindset as strong as possible?
Yeah, I mean, right now, there are a couple of people that I'm working with who have cancer, but not, you know, I would say not any advanced stages of cancer.
Sure.
So at least not right now, because my practice is constantly changing. The types of people that I'm working with are constantly changing. One of the nice things about this kind of work is that people actually get better, and then you see new people.
Yeah.
So that doesn't happen very much in traditional psychiatry. But no, I have definitely worked with people with cancer over many years of my career, and right now I can think of a couple of people that I'm working with who have cancer. And I think that this is the thing, that the whole body, not just thinking about the mind, but thinking about the whole body. The same principles apply in treating somebody who is living with cancer, people who are living without cancer, and think how many people may be living with cancer who don't know it. So you have this information, but there are a lot of people in the world who may have cancer and not know it, or may have some other kind of a serious illness and not be aware of it. And so no matter whether we have that information or not, taking good care of ourselves emotionally and physically, environmentally, with our relationships, and stress reduction, and avoiding substances, and eating well, and all these other pieces are always important, no matter what is going on for us. So none of those other things we should take care of ourselves no matter what. And I think that the people that I'm working with who have cancer are people who are, of course, they're coming to me because they want a different way forward. So these are not your average people. These are people who are looking for a different way to live with the illnesses that they have been diagnosed with, and hoping that they're going to improve as well.
Yeah, that's awesome. I overheard you earlier when I was in and out of this event talk about your secret weapon being carnivore, when you have to get to it, the carnivore diet, which is super awesome. I love to hear that, because I with the carnivore diet, I've been watching lots of videos about like how it's great for kids with autism, with kids with mental illnesses and stuff like that, and obviously great for me. Above and beyond the carnivore diet, you as a psychiatrist, do you ever prescribe any pills to help the mind that in terms would benefit the body, in terms of trickling down to what I'm doing with, like, is there anything that I should know of that may benefit on top of the carnivore diet? Natural pills, like I am a little bit part of my regimen is and I do live in Canada, so it's legal over here. Cannabis, THC, mostly CBD to get me into a deep sleep, because my friend Dr. Dwight, he tells me I need to make sure I'm resting and I'm sleeping well, in terms of really trying to heal that mitochondria, right? So mostly CBD. I have ventured in a little bit to THC if I really need to get to sleep. Do you ever, I don't know, like, you're in the States, is that brought up a lot? I know Canada is a little more liberal, I guess, in that sense.
Well, a lot of these, cannabis products are legal in many states here, and I know that they are in Massachusetts. It's been for a number of years now. So when I worked on college campuses is when it started to become legal to use medicinal products. I personally have never prescribed them or recommended them, just because that doesn't mean that they can be beneficial. I want to make that really clear. The reason why I don't is that I choose to focus on food. So I choose to focus on nutrition. So that's simply the focus of my work. And so it doesn't mean that they can't be useful. I just don't have the experience.
Gotcha.
So that's what I want to let you know. Yeah.
Okay, sounds good. I'm currently trying to do some research, because Dwight has talked to me about it, and he's going to do more research about RSO. I'm not sure if Dr. Hampton or Dr. Shafee has heard of RSO. I think it's Rick Simpson oil is what it stands for, to treat cancer. And Rick Simpson oil is extracted from THC. So I'm trying to do more research on that one. I always try to pick the experts' brains as much as possible. I know, like, Dr. Hampton, especially your presentation with me and Carrie. It was amazing because you had a list of things, and I've picked and chosen a few things, including like a parasite a pill that I just actually started taking this week. So sorry, Dr. E, I didn't mean to put you on the spot there. I just wanted to.
Oh, no, not at all. You can ask me anything, and I just
sounds good.
have the experience to share. Yeah.
Excellent. Thanks.
Real quick, Carrie, we have a bunch of super chats that we're probably going to have to get to. So are we
Speed
ready
round?
for Q&A? Yep.
Sure.
Cut me
All right.
off.
And Jeff, you're welcome to stay on if you want to. I know you're the last individual.
I'll stay on. Sounds
Okay,
good.
cool.
Thanks.
We'll try to go through these pretty quick because there's a whole bunch of them. Really appreciate everyone who's watching, by the way. Dr. Ead's book, Change Your Diet, Change Your Mind. There's a link in the description below. There's a link for everyone that's on the screen right now, including Jeff's channel. So make sure to go subscribe and check all of them out. The first one we have here, Annabelle, the Happy Carnivore. Carnivore switched off atypical anorexia in 2 days. That's amazing.
Wow.
Wow.
Sandra McDougall, $15 super sticker. Thank you so much. Any super chats we get go 100% towards our documentary, so we really appreciate that. $2 from Southern Joe's. How much fiber is essential?
That much.
That's a good one. Speed round, like it. A bit wrecked, $10. How effective are these dietary interventions on personality disorders?
They can be helpful. They're I think along with certain types of psychotherapy, they can be very helpful, especially in the reactivity that can happen with certain types of personality disorders. Absolutely. Can be very stabilizing from within.
Thank you. Anthony, $50. Thank you so much. Nur Jimenez, question for these awesome doctors. Is it okay that I downgrade to ketovore at times, but definitely no junk or seed oils, just sometimes with seasoning on my meat, coffee, butter, whipping cream, MCT8? Thank you for what you do. At least keto, not Cheeto.
Well, look, it's obviously better than the alternative, but it's, you'll see in yourself, if you try adding something in and you see it affecting your health, you just be aware of that. And if that's okay for you at that time and that fits your lifestyle, then that's great. You always have that baseline to go back to. You can always go back to just pure carnivore. I choose to live there because I just like feeling my best all the time. I could add some spices in, and I don't have autoimmune issues. I don't have a lot of other issues that would require me to stick to only red meat and water, but I prefer to because I just feel better. But if that suits your lifestyle, that's totally up to you.
All right. Super sticker, $14. Thank you so much. Cat A, $5. Thank you so much. Hey, it's Russ, Homesick Buckeye. $10. Shout out to my brothers and great prophets, Chafee and Hampton. The Reverend sends his best and says you are behind on your ketogenic tithe. That's our good friend, Russ. Thank you, Homesick Buckeye, Russ. $2, Nancy Chandler. Thank you so much. $5, Nancy Chandler. Hey, guys, great podcast. May I ask if Dr. C is familiar with MDS and symptoms?
MDS. Sometimes the acronyms you don't always know. I don't know which MDS they may be talking about, though. Yeah, it could be myelodysplastic.
That's what Google says it is.
Yeah. No, I'm not too familiar with those, unfortunately. I just, but it'd be interesting. Some of these things we don't have obviously we don't have studies on just carnivore all the time, but they're coming. There's more getting out there, but there are a lot on ketogenic diets. There are thousands of studies on ketogenic diets. Carnivore is a ketogenic diet, so you can transfer some information from that. So if you look up that or any other issue and you look up ketogenic diets, see if they're done trials, many have been done, literally thousands at this point. And so if you see ketogenic diets or fasting mimicking diets or fasting improving any of these problems, a carnivore diet should help them as well for the same metabolic reasons.
Yep.
All right. Why is fiber so bad? It is not good for your gut, ?
We're just not, we're not set up for it. We don't have the capacity to digest it and absorb it. In order to beef up the fiber content in processed foods like cookies and ice cream and things like that, and there's fiber. Why do you need fiber in ice cream? They put in sawdust. That's what fiber is. It's cellulose. And so they put sawdust in these items. Is sawdust an essential nutrient? An essential nutrient means if you don't have it, you will die. That's what essential means. And so I don't think you're going to die. In fact, I know you're not going to die if you don't have sawdust in your diet. We used to have a capacity to break down fiber. That used to be our cecum. It's now an appendix. In a gorilla, it's 4 feet long, and that's where fiber packs into, ferments, and breaks down into saturated fats and protein from the bacterial die-off. We don't have that capacity anymore. So if we had that capacity, then we could gain benefit from it. At the moment, we don't really get any benefit from it. There can be things that can cause harm. First and foremost, being that it can cause a barrier layer between your enzymes and the food that you're trying to digest, and then the broken down digested food and the lumen of your intestine to absorb it. So depending on who you look at, like Dr. Robert Lustig quotes in his book, Metabolic, that eating fiber with your meal can actually reduce absorption of nutrients by up to 30%. Now he's talking about this as a positive. If you're eating fruit, this reduces the fructose and sugar absorption. I look at it as a negative because I'm not eating anything harmful. If you're eating something harmful, reducing the absorption by 30%, probably a great idea. But if you're not, if you're just eating proper nutrients, then you want to absorb all those nutrients. So there's things like that, but the list goes on. There's even potential for causing microabrasions and actual physical damage to the lining of your gut as well. And there's studies looking at interventional trials, looking at people with symptomatic constipation, getting anal fissures and painful symptoms and gut symptoms. And they stratified by fiber. They had 4 groups. One kept the same amount of fiber, one increased fiber, one reduced fiber, one eliminated fiber. And it had sort of the exact opposite stratification that you would predict based on what we've been told for the last 40 years. People that stayed the same, obviously. People that increased the fiber actually got worse. People that reduced fiber got better. People that eliminated fiber, 100% of them resolved 100% of their symptoms. So this is not what we've been told it is. If you have some fiber and some fruit or some whatever every now and then, is it going to kill you? No. But do you need it? Definitely not.
All right. Thank you. Cat A, $20 super chat. Thank you. Sean Johnston, $10. Bella Brett, for you, I'm giving this to send good vibes for Jeff and F the fake cancer trolls. Thanks to you all for this great live. Love it.
Oh, thank you.
Homesick Buckeye, another one for Jeff. Shout out to my brother Jeff. Tell the haters your cancer may be fake, but when you knock them out, it'll be real.
Hey, Homesick Buckeye. You and I were in a box one time. Remember that? But I'm trying to follow. I'm trying to follow Bill Knott's theory of be kind. So thanks, Homesick Buckeye. But so I'm trying to live my life, be kind. And while I'm here on that topic, I just quick shout out to everybody listening. Carrie Mann and JT, they posted 2 great videos today that my son and I watched. It was an hour and a half long. It was like Carrie. There was like a talk about being kind, knocking on people's door, wanting to cook them a dinner. I was blown away by it. So was my son. And I quickly. Everyone should watch it, because stop watching like The Bachelorette and Bachelor. I sent that to my wife and watch this episode with Carrie and JT. It was well done. Thank you, Carrie.
Appreciate it, Jeff. I'm looking forward to getting back up there filming you again and hitting some Canadian doors.
For sure. We have to say sorry. We have to say sorry a whole bunch of times before you.
Right? Eh?
Yeah.
Sorry.
Hi. Chafee, you're a unit. My good man, never go vegan.
Never gonna happen.
Awesome.
You should dress up as a vegan for Halloween.
Yeah, that's right. It was just pale and pasty and just like shriveled up and things like that. Just angry and yell at people. Yeah.
Wow, fast enough. $200. Thank you so much.
Wow.
Thank you for the wonderful panel.
Thanks.
What a wonderful evening of information and testimonies. This is a fantastic community. Thank you so much. Paula, $20 super chat. Has anyone seen a person with Graves' disease, hypothyroidism heal on the carnivore diet? I'm ready to go all in, but need to be sure this won't increase thyroid hormone levels and antibodies. Appreciate you all.
I've had a few patients with Graves, and yes, they have absolutely improved. I've yet to see an autoimmune issue not at least respond very favorably to a carnivore diet. I find that it's best when there's just red meat and water. Sometimes they can even respond negatively to certainly dairy, eggs, but even chicken and pork. And so for best results, I would definitely try just the red meat and water. For best results, if you're not getting as much results as you want, just grass fed and finished seems to make a bit of a difference as well. But I think it's marginal compared to the rest, eliminating out the rest. Also, it's something that I've seen a lot of in the different carnivore forums, such as Zero Carb Health and Zeroing In on Health on Facebook. Those are two great ones because they've been around for years, like well over a decade, probably 15, nearly 20 years. I don't know how, maybe, 15 years, call it 15 years or more. And they have an amazing database. You can just do searches in there for Graves' disease. You will see hundreds of people talking about it and talking about their experience on there. And I've seen so many people respond very favorably to that. So yeah, I've never seen it get worse. I've only seen it get better. And so I think this would be a very positive thing in your life. I don't know if other people have had experience with that as well.
Yeah, mine's been anecdotal, but I've had people get better. I agree. Nobody's gotten worse. And I just think that, but most of my patients may find that they still need treatment. But just like Dr. Georgia E would say, when our goal is not to not take medicine if you need it, our goal is to heal you metabolically. And if we can reduce the medicine burden, that's better than they were before they started their journey. So that's been my overall experience.
Yeah. Well, I think that's a very important point too, because some people see amazing results with a carnivore diet, like with diabetes or autoimmunity. And so they go, great, I'm going to go carnivore. I'm just going to stop taking my meds. And then they have pretty bad results with that. And like, oh, why is my blood sugar 150? I was like, okay, well, well, are you on medication? Yeah, but I just stopped when I went carnivore. Can't do that. You need to stay on your medication. You have to keep going. Eventually, you might be able to reduce or even eliminate your medications, but you have to do it in a structured fashion. You have to do it when it's ready. And so keep taking your medications, keep using the treatments that your doctor has prescribed. But this is a very, very, very strong adjunct. And it could be that it ends up replacing the medications that you're on, or even eliminating the need for the medications. But it's going to be a transition, and you can't just drop off overnight.
And real quick, Dr. E, I remember when we did our podcast literally 2 years ago, and at the time I wasn't carnivore, and I told you, I said, guess what? You're going to talk me into carnivore. Well, you and Dr. Chip and the rest did it. So, but could you just briefly, I think you shared what percentage of patients tend to, get off medicines versus, improve. Could you just briefly tell, because I think people need to have a sense of what to expect.
Yeah. So, and I want to make it clear that these are people who have stuck with the dietary changes, right? Yes. So, and to be very honest, not everybody does. And I think that's important to point out. So, but when people are able to adhere to a much healthier diet or the ketogenic or carnivore diet, I see really good results. So I see people who have not yet started medications do not need to start medications. So they're able to avoid starting medications in the first place. And people who are taking multiple medications, even sometimes very high doses, some of those people are able to reduce either the number of medications they're taking or the dosage of the medications they're taking. And in some cases, people are able to wean completely off the medications they're taking. And I would say that most of the patients that I've worked with over the years are able to would fall into one of those categories. There are some people, I can't say exactly how many, I've never counted, but maybe if I had to guess, 10-ish% or so of patients who don't experience the ability to to reduce their medications. And so, but the good news is that even in those cases, even in the small percentage of people who still require, even with a healthy dietary plan, even though if they may require medication support, if they can't change anything about those medicines, it's still a really wonderful because these diets, the ketogenic and carnivore diets and similar types of diets that I use in my work, these diets help counteract the side effects of these medications. So it's a really nice combination. It can help the medications work better, and it can help them be better tolerated. So for example, if someone gains 50, 60, 70, 80, 90 pounds on an antipsychotic, and you add a ketogenic or carnivore diet to that medication, you can lose most or all of that weight that you otherwise would have been carrying around, indicating that your metabolic health was really suffering as a result of those medications. So even for people who either want to stay on their medicines or need to stay on medicines can get tremendous benefit from adding these healthy diets, these healthy metabolic and nutritional changes to their lives to those medications and to psychotherapy and other kinds of interventions. So it's not an either or. It's really, really, in fact, the study that we published about a year and a half ago, there were 31 patients who came into the hospital as volunteers with very serious chronic mental illnesses, schizophrenia, bipolar disorder, severe major depression. They were all taking an average of 5 psychiatric medications, and then a very mildly whole foods, mildly ketogenic diet was added to that medication regimen, and every single person improved. Almost everybody lost a substantial amount of weight, despite the fact that they're taking these medicines in most cases that are causing a lot of weight gain. And 64% of them were able to leave the hospital on less psychiatric medication. So it doesn't have to be an either or. It can be a really nice synergistic kind of, the two interventions can coexist and work together. So I think, regardless of what your goal is with medicine, some of my patients don't want to go off their medicines because the medicines have been really helpful to them. And so they just want to feel better on their medicines and be healthier on their medicines. So I think that's a really important thing to remember too. It doesn't have to be all diet in some of these cases.
All right. Bella, Brad, for you. Wow, $300. Thank you all for volunteering your time. It impacts more than you all know. Wow.
Goodness.
Thank you so much. So generous. Westfield 90, $5 super sticker. Thank you so much. Hey, Sandra, One Hope for All, $10. Prayers for you, Jeff. Wow, I think we got through the super chats. I got to shout this out again. Change your diet, change your mind, Dr. Georgia Eid. Dr. Eid.
Yes, Karen.
I'm so thankful you wrote this. I can't imagine the amount of work that went into this. All the sources, all the science. It's so engaging. My only criticism is I really wish you would have done it like 20 years ago when I really needed it the most. But I'm so thankful you did this. Could you just, while we wrap this up here, we're getting towards the end of the hour. Where does your passion come for this?
Well, so first of all, I didn't know a thing 20 years ago. I would have been completely useless to you. And I mean, passion really comes from, I went to medical school to become a doctor so I could help people, right? Mm-hmm. I love helping people. My mom loves helping people. She's 90 years old. She still helps people to this day. She takes care of 2 developmentally disabled adults in her home full time. It's in my bones. It's just my favorite thing to do. I love answering questions. I love helping people, figuring things out. I love getting to the bottom of things. It's my favorite thing to do. So when I came across this problem that I didn't understand how to solve, I became really curious, and I just really wanted to dig in and see if I could get to the bottom of it. It never made sense to me. Things I learned in medical school and residency about psychiatry, I never really felt like I was really understanding what is going on in the brain. No one's telling me. And it was all very frustrating. And the principles that I was taught, they helped a little bit, but they don't help enough. So I was just really curious to understand about nutrition. When I figured out my own, this crazy diet that solved so many of my problems, I really wanted to understand that. And then I wanted to help all the patients in my practice that weren't getting better. So I love practicing this way. I love thinking about these things. even though the book was really hard to write and was a lot of work, I love that I was able to put all this information in to try to help people who don't know anything about these strategies. These are really powerful, as everybody here knows, really powerful therapies that you can do so much more with your diet than any medication. These help people in ways that no medication can. And most people don't know. And so that really made me driven to put the information all in one place, not just about mental health, not just about ketogenic diets, not just about meat, but not just about nutrition science. But if you put it all in one place, then people have one place they can go to and where all the dots are connected. Because right now we've got is a book about this aspect, a book about that aspect, a book that looks at this aspect of diet or this aspect of mental health or this aspect of nutrition science. If we put it all in one place, then people hopefully will be able to see how it all fits together, and then they can be empowered to make these changes. And within a few weeks, in most cases, people will feel better. And this is really, once you practice this way, it's really hard to go back to the other way of practicing. I mean, it's a partnership, it's cooperative. It's not me telling somebody what to do and I have all the knowledge. It's me working with you to, get you curious, and then you show me what's possible and you discover what's possible for yourself. And then I learn from you. So much of what's in this book, I learned from my patients. I think this is really important to say, believe your patients and listen to what they tell you and trust them and have faith that they can do difficult things. We can't write people off and say, oh, that's going to be too hard for them. They get to decide what's too hard for them, not us, right? And so many doctors think, oh, I could never ask my patient to give up. Well, that's up to them. Ask them if they think that it's worth doing. People are a lot stronger than we give them credit for. And if we give them the right information, the people who want to do it will do it. And I know most people aren't going to change their diet. It's hard to do. A lot of people don't want to do it. But there are people out there right now who think they're doing everything right. They really do care. And they're trying all these dietary interventions that they've heard about that don't work. And they actually do care, and they will do. If they have better information, they will get better results. And so for all of those people, that's what this information is here for. And that's what gets me up every morning is making sure more people know about this, just in case they want to try it. So have those options, have real options that actually are worth trying.
Awesome. I love that. So one last question before we possibly wrap up. This is a question for the panel. So we've talked about how diet can improve your mental health, but for those that are listening, what are some action steps that someone can take to improve their mental health right now?
I'll just start by saying, my brain is all about looking at the big picture. And one of the messages I wanted to share tonight was this idea of this is a soup, right? So one of the things that the Dr. Ornish study was criticized for when he talked about, plaque regression and things like that, is that they didn't factor in, oh, we did meditation. Oh, we reduce stress. Oh, we make sure they had enough sleep. Oh, they exercise. Oh, is it the plants or is it those other things? And I just think when people are thinking about ways to live longer and be healthy, I need you to think about all the things you can do, as is what Jeff is trying to do. He's like, hey, what else can I do? Because carnivore is not enough. We need to do all of these things. So I feel like my marriage is so much better because I have a therapist to talk to. And I just feel like I need to talk to somebody. She needs to talk to somebody. I need to talk to somebody. I think that medicines work for people sometimes. So it's okay. And if you're going to bridge it out of your life, you better bridge it. Take your time and ease it out. And then there's other modalities for mental health. Cognitive behavioral therapy, that stuff works for some people. They have DR and all kinds of things. So when you think about healing, I want you to be like Jeff. I want you to think about all the various ways you can heal. And because you won't even know it's going to help you if you've never tried it. I mean, I was a plant-based guy for years. Then I went low carb, keto, and carnivore. And if it was not for experimentation, I would have never landed here. And I think this is the right place for me to land. But I'm also trying to continuously improve. So my message to everybody, what are you not doing well in life? And what can you now then focus on for 2024? And then when you finish 2024 and you've mastered that one thing, rather sleep, stress, whatever, what else can you work on? And if you heal your body that way, then it'll be much easier if you face cancer to deal with it. It'll be much easier. So I want you to not think of one thing. Think of all the things you can do. And if you do that, I think that your mental health will be where it needs to be.
Amen to that.
Awesome.
Yeah, definitely.
Dr. Eid, can you answer that? What could be some possible action steps that somebody can take right now to help improve their mental health?
Yeah, so I think the first thing, especially if you're starting from a regular diet, is just to switch your diet to whole foods and get all of the processed and factory made ingredients and foods out of your diet as the very first step. And that's not easy to do. It takes some practice, but that alone can make a big difference. And that is something all of us should do, regardless of whether we feel healthy mentally and physically right now, because that's going to reduce your risk long term for all kinds of problems. So step one is always take the junk out. And then once you get good at that, you can make some next steps. There are lots of steps you can take towards a healthier diet. And I really think the other piece of the puzzle is just stay open-minded, stay curious, stay positive. Get yourself tested for insulin resistance and nutrient deficiencies. I show you how to do this in the book. Figure out where you're at right now, and then chart your course. Where do you want to be? So where are you at now? Where do you want to be? And that way you grab that wheel and you take control of that car and you decide where you're going to go. I mean, I can tell you what I'd like you to do, but it doesn't matter. You get to decide where you go and how you get there. And so we're just giving you, all of us here, we're giving you a map, but you get to decide not only where you go, but how fast you go. And when you want to leave. So I think that, remember, you're in control of this. Health is not about doctors telling you what to do. We give you information. We're advisors. We're counselors. And we're partners in your health. But you are the one in control of this, and that's what makes it so hard. But that's what makes it so great. Because if you get better, you're going to feel so proud of yourself. You're going to know that you did that, and nobody can do this for you. So if you think you've tried everything already, hope is on the menu. That's what I like to say. Hope is on the menu. You think you've tried everything, you're wrong. There's so much more you can do if you stay open-minded and curious and positive, and just take an experiment, take a discovery approach, a curiosity approach to it. Keep your mind open.
Yeah.
I love that.
I probably don't have anything to add to that, really. I mean, I agree wholeheartedly with with both of those statements. I think it's very important just to cut out the garbage, first and foremost, and to just have the mindset, like Dr. Eid said, of understanding that there are things that can help. It's not hopeless. You're not lost. It's not just like, well, it's just these medications, and if they don't work, then they don't work, and you're sunk. That's not true. There are things that help. There are things that have helped a lot of people. So be hopeful. And maybe it's not something that you can do in effect, but at least it's out there. And I think a lot of people, once they see that and they understand that, and they go like, okay, I want that. Just like, we've had people say, tonight, it's just like, hey, I saw Carrie and I wanted that. I wanted that energy. So I went for it. Sometimes it just takes that bit of an impression for people to really get it and take it seriously. Sometimes it's like, well, that can't possibly be. Whereas if they saw the contrast and they saw like how much this could help them, I mean, they'd just be running after it. And if I knew how good I could feel by eating this way, there was no chance I would ever have eaten any other way in my entire life. But I just didn't know about it. I didn't know about it until I experienced it. And now people are learning about it because people are talking about their experiences and they say, okay, I want that. So just understanding that there are things out there, and like we say, take a sky view on this. There's a lot of things. Diet is such an important part, but there are other things that are important too. Trying to reduce stress, getting better sleep, doing the cold plunges, getting outside, making sure that your family connections and friend ties are important, because we're social creatures. This is important for our mental health and our sanity, to have these social bonds with other people, and animals for that matter. And at the end of the day, we work for you. Doctors work for you, and you are the boss. You go in there because you need help, and you're asking. Somebody's coming to fix your deck. You say, how are you going to fix my deck? Oh, I fix it like this. Well, I don't really want it like this. Well, you're gonna damn well get it like this. That's not how that works. So you don't need to listen to advice from doctors that doesn't fit well with you. You can get second opinions. You can try things out for yourself. We are there to advise. We're there to give you our best advice and our learned opinion and our educated experience. But you're the one who has to affect this. And it's a really bad idea to give the decision-making responsibilities to people who pay no price for being wrong. You're gonna be the ones suffering the consequences if this goes pear-shaped. So you need to be really confident and really happy with how this goes, and that I think helps with the doctor-patient relationship as well. If someone is really bought into the program, compliance goes through the roof. If the patient is like, this is what I want to do this with you, great, let's do it together. You're going to be much more likely to succeed in that as well. So always remember that this is about your life, this is about your health, and don't lose sight of that.
All right. Hey, we got one last super chat. Best few hours I spent in a long time. Thank you, good people. Jeff, you inspire me. Keep on keeping on, my man.
Nice.
Jeff inspires a lot of people. All right. Well, Dr. Eid, thank you so much. Again, I encourage everyone, change your diet, change your mind. I hope you're proud of yourself, Dr. Eid. This had to be an incredible amount of work, and there's so many hopeless people in the world that I know this is going to help them. It's such a powerful thing. So thank you so much.
If it helps, that'll make me so happy. Thank you very much. It was really, really kind of you to invite me on this evening and to be with all of you. Thank you. And thank you, Jeff, and everybody else who shared your incredible stories. I'm leaving feeling even more inspired.
Yes. And thank you, Dr. Chafee. Thank you, Dr. Hampton. You guys are amazing. I have links in the description below for all of these channels. Jeff too, Adam, Carnivore Today. Shout out Lynn, Midlife Carnivore. She's helping us with all the super chats in the background. So
yes.
Thank you all so much. Does anyone else want to add anything before we wrap it up?
Yeah, I just want to just a bit of a shameless plug. I'll be putting my interview with Dr. Eid up on my channel this Sunday in the US, Monday morning in Australia. So if people want to come see that, I welcome you. I always do premieres, so I always do it sort of live, and everyone's welcome to join and sort of chat live in the text and as we watch. So if people want to see more of the good doctor, that will be this Sunday coming.
Awesome.
Love it.
And one more thing, guys. I was just looking at Amazon. It's the #1 keto book on Amazon. #1.
Nice.
So congratulations, Doc.
Awesome.
Thanks to all of you. I'm
Congratulations.
sure that's because of all of you. Thank you.
I just want to say thanks. And it's been a pleasure meeting you, Dr. Eid, and Dr. Hampton and Dr. Chafee. Thank you so much. Dr. Chafee, I'll see you in like 7 or 8 hours. And I'll be wearing my black Adidas hat.
Yeah, nice.
All right. Thank you, everyone. Have a good night. Bye.
Thanks, everybody.